Give me about 2 minutes. It says preparing, so it's setting up for the meeting.
Thank you.
Give me about 2 minutes. It says preparing, so there we go. Sorry. Setting up. All right, we're now live on YouTube, and we do have all the commissioners, the interim county manager, the acting county attorney on the line.
Thank you, Monica. Today is June 3rd, 2021, Board of County Commissioners Budget Work Session Day 4, and I will read the public charge. The Board of Commissioners ask its members and citizens to conduct themselves in a respectful, courteous manner, both with the board and fellow citizens. At any time, should any member of the board or any citizen fail to observe this public charge, the chair will ask the offending person to leave the meeting until that individual regains personal control. Should decorum fail to be restored, the chair will recess the meeting until such time that a genuine commitment to the public charge is observed. This meeting is called to order. Our first item today is 210378, behavioral health infrastructure discussion, and I will turn this over to our county manager, Hager.
Good afternoon, everyone. I am excited about today because we're inching closer to the finish line.
Yeah.
We will kick off today, as Chair Howerton shared, with a discussion about our behavioral health infrastructure, and Gudrun Palmer will share the highlights of this presentation, and there are others that will join in. So I'll turn it over to Gudrun.
Good afternoon, commissioners.
Good afternoon.
I hope you will.
Thank you.
So I have been asked to walk through the slides with you and talk a little bit about the Sequential Intercept map and our Stepping Up initiative that we have had in Durham for a number of years now. And I think the slides will move by magic. So I will just talk. And so we were hoping to change the conversation or the discussion from mental health and expand it a little bit into behavioral health. And behavioral health is often used interchangeably with mental health, but it's actually a broader definition where it talks about not just a person's state of mind or their psychological state, but also their physical condition as well. And so as we going through the Intercept map, I would like for you to think not only about people with mental illness, but also those with substance use disorders. You received in your packet, and I think earlier also in an email, a document that detailed the current investments that Durham County has made in behavioral health. It listed goal 2 and goal 3, and then several other funding sources. But and you should have. I believe we have representation from all the departments that you have listed here. Maybe not the youth home. Angela is on vacation, but Alliance, Public Health, DSS, all have representatives here. We have EMS, and the sheriff is on this meeting as well. And then not only are you investing a lot of money in different departments and to support individuals with behavioral health issues, we also have several cross-agency collaborations currently happening in Durham. For one, of course, the Stepping Up initiative that I will go into more detail on. The Durham Joins Together task force that I think you had a pretty extensive presentation, maybe at an April work session. And the DJT, that task force actually has a mental health subcommittee that focuses a lot on substance use disorders and services, and the subcommittee meets every month. And then the new safety and wellness task force that has met now maybe 3 times, that is also a joint joint jurisdiction, city, county, and the school board, an initiative, and the task force will work 18 to 24 months and we'll look, among other things, at some of the behavioral health services that are happening or ongoing. Next slide, please. The Stepping Up Initiative. The Stepping Up Initiative is a national initiative. It's not Durham, did not originate in Durham, but the Durham County Commissioners, almost to the day, 6 years ago, on June 8th in 2015, passed a resolution joining this national initiative. It's supported by NACO and a number of other national organizations. The Stepping Up Initiative has a number of objectives, and it was initiated to reduce the number of individuals who go through the criminal justice system that have mental illness, substance use disorders. So in Durham, we had the resolution, and then we stood up the work group that met every other month. Since 2015, we had a little bit, we took some step backs during COVID, but until COVID, until the pandemic started, we met regularly. And we also had several work groups. One was around the mental health court initiation. One that continues is looking at data. And one work group that I remember was the Incapable to Stand trial. There are about 40 counties in North Carolina that also have joined this Stepping Up initiative, but there is no statewide collaboration that I'm aware of. There are a number of agencies that are represented on this Stepping Up initiative. We always had county commissioners attend. Commissioner Howerton, Commissioner Reckow, Commissioner Foster were regular attendees for many years. And Commissioner Jacobs is listening in or is attending our meetings now. Sheriff's Office has always been well represented. Durham, the Police Department, EMS, Alliance, Criminal Justice Resource Center, the Public Health Department, and then we have probation, our court officials, we have judges, we have the Public Defender's Office, magistrates, we have RI International, a number of mental health provider organizations, housing agencies, Duke University, and NAMI, and I'm probably missing a few, but we have regular representation and participation from many of those organizations. So the objectives that you have in front of you are kind of focused on these 6 intercepts of the sequential intercept, and for one, the prevention, and that's the community piece, right? The prevention of the initial involvement of people with behavioral health problems in the system in the first place, which is something we all want to see happen more and more. The decrease of the admission to jail, that would be our law enforcement side, engaging individuals in treatment as early as possible. That speaks to the early identification of individuals with behavioral health issues, minimizing their time in jail, trying to identify who can come out, who does not represent present a risk or a danger to the public, and then linking them to treatment after their release, the reentry piece, and decreasing the rate of return. Again, the recidivism and the reentry. Next slide, please. So this is kind of the initial model that is not, again, it's a national concept, and the Policy Research Associates came up with that and have designed and elaborated on that over the last 20 years. It is an umbrella. It looks at the entire system. And for those of you that have not been involved in this process, in this discussion as long as others, Intercept Zero is actually a new addition to this. And what has happened over the last 2 or 3 years is the discussion or the PRA and SAMHSA, the Substance Abuse and Mental Health Services Administration on the federal level, took the first Intercept that was initially called community and divided into community service and law enforcement. And I think that speaks to that the field is realizing more and more that the community part at the very beginning is the most important piece, and it should not be lumped together with the first contact with law enforcement. So there is another step in before that part that we need to take a look at and further define and further analyze and find opportunities in that space right there. So this is the general model. This is what we started with. Again, you know, we had 5 intercepts, not 6, but this is what we started with. And back in 2015, 2016, we mapped this very rudimentary for Durham, and over time we became more sophisticated. I think Commissioner Howard probably remembers this initial map, right? Do you remember this one? So
yes, yeah,
where we kind of on our own, we identified the services, and then we identified some of the gaps and the opportunities, and we color coded it to kind of guide the way to also help us see some progress. And then the North Carolina Department of Health and Human Services actually offered a Intercept mapping workshop for communities, where they had trained a number of facilitators to work with individual counties to do this mapping. And so we requested, and we were one of the first counties to receive some of the trained facilitators to go through this again with us, because having a trained facilitator trained by the organization that initially came up with this map was helpful. So we wouldn't just wing it or do this on our own. And so if you go to the next one, please. Next slide, please. So this is the product of our sequential intercept mapping workshop that we had in February 2019. We had Dr. Tanya Bendense with UNC and Dr. Megan Pruitt with Duke. They were the facilitators assigned to us from DHHS, and we spent 2 days with them initially. Talking about what do we know, what do we have, who is here, who is missing, and then we looked at discussing various the individual services, but then also talking about gaps, and the final few hours were focused on coming up with priorities and an action plan. And I believe you have a copy of that report that was issued. And so in Intercept Zero, it's really the the services that we have in the community that are looking at that may touch a person with behavioral health issues, especially in crisis. And so it looked at hospitals, crisis, respite care, community services, and we identified, as you can see on this map, just, even though you may not be able to read it, but I think you also received a separate copy. You see, we identified a number of services and organizations that we were aware of. And let me caution or say one more thing. This was the map in early 2019, right? A lot has happened since 2019. I think we had 2 decades that have gone by in the last 2 years. So our services and our map, if we do this again, it may not look exactly like this anymore, because some of the organizations we had 2.5 years ago may not be around anymore, or we may have new services, new organizations. But so we identified a huge number of people, of individuals who were CIT trained, first mental health first aid, mobile crisis, the 211 information line, our NAMI supports network of care information. So we not only looked at organizations, but also worked with individuals in the community, receive information about resources. And then also just a number of things that were happening around early childhood ACEs. I think the early childhood trauma, I'm sorry, I can't remember what ACEs stands for, but early childhood trauma and some of those concepts and approaches to addressing early childhood trauma. Mm-hmm. We also talked about gaps in there, that does everybody get a CIT trained officer who needs one, or how fast does mobile crisis respond to individuals when they are in a behavioral health crisis. A lot of people are not aware of various call centers where you can get information or access to care. Then we looked at the law enforcement and emergency services and realized that at that point, almost about 40% of our law enforcement officers were trained in CIT, that the sheriff's office, as well as the police department, had mental health first aid training. And I think the sheriff has also added mental health first aid training for detention officers and CIT training for them as well, and de-escalation training. So, and then where do they know where to take individuals in that, if they encounter someone, do they know whom to call? So, and we identified a few in that as well. We looked at detention and the initial, basically the 24 to 48 hours. For the court hearing, when someone goes to gets booked into the detention center, they have a medical screening that also has a mental health screen. And I think lately, within the last year, I believe, there's also a substance use screen to identify opioid disorders. Then we have a pretrial screening for their initial court hearing. So we reviewed those and then identified a few opportunities of what else we could have in the system to have a better process, or to make sure that individuals who need assistance also do receive that assistance. We looked at jail and court. Sorry, my computer says it's about to restart. be a problem. We looked at the courts, and while someone is in the detention center, I already mentioned the additional mental health training for detention officers, the services, the STAR services, and then the jail mental health services in the detention center, and a number of services that are associated with those two programs. Specialty courts, and I know there were some discussions around a veterans court at some point, but so and the different health screenings that are happening and continue, because if someone stays in a detention center, they continue. There is regular checkups and a medical provider not only does the initial screening, but has a 14-day screening and then in certain intervals. And again, there's always the need for additional trauma-informed services, and yeah, I mean, we have a lot going on, but there's always some ways to do things better. The reentry, I think Durham has done a great job around reentry. We have had reentry services for probation for 20 years, and Alliance is working with the prisons at the North Carolina Department of Public Safety. When someone is released from prison with a mental, with a behavioral health, no, with a mental, with a serious mental illness, then they work with Alliance to set up services right away. We now have, and it might not even be on this map, we now have a jail reentry program for people with co-recurring disorders. That is a federal grant that the Criminal Justice Resource Center has currently. So, this is a dynamic map, right? It changes all the time, and hopefully we can continue to populate it and not take some of those bubbles out. And then the last one is community correction and community programs. And great thing is, for example, that Durham Probation has mental health, specialized mental health probation officers who have received a lot of training and are better equipped to work with individuals that are that have a behavioral health disorder. And then also, we also identified some, like if someone comes out of the detention center and it's late in the evening, do they have housing, and where can they go? And so a lot of the wraparound services in their immediate, trying to meet their immediate needs. So this was our sequential intercept, and I did that very quickly, but we mapped it. We had an action plan, but our action plan was not around identifying, programs to fill in gaps. We were more focusing on public awareness and trying to work better together. Access to housing has always been a huge issue and concern. We talked about that individuals with mental health disorders are in the detention center longer for the same charges that usually people with that are not identified with mental illness, and then just some funding issues or funding ideas. So we identified a lot of priorities, but then focused on kind of more the collaboration, the awareness, and what can we do better with the things we have right now. And that's where everything stopped, because then our world changed as we knew it. So I think that's, I'd be happy to answer questions in a minute, but that's pretty much walking you through the sequential intercept map for Durham as it was in 2019. Can you go to the next slide, please? And so I think some of the next steps, if you are interested, or if you looking for some recommendations, would be to go back and look at that map further, and go back to our facilitators and for one, update it, but then go much deeper and come back with a more expensive map and gap analysis and recommendations to you in early 2022. There's a lot happening already in our community right now. The city is starting the community safety department and has a number of pilot projects that are aligned, that are starting in the community safety department, especially around the call for service. So definitely staying connected and coordinating between the county and the city's efforts to make sure that it's seamless and we're not duplicating anything. And as always, those strategies should always be data driven and produce measurable outcomes, so we can actually take a look, and then also investigate in the possible future funding options. And I think there are, we were looking at some grants yesterday, but looking at some opportunities on how to fund the gaps and maybe some priorities that are rising up over the next 6 to 8, 10 months. And that concludes my part of this conversation. But I believe we have a number of individuals on this call that are connected to this, and also with Alliance, I think is here. Director Jenkins and Ms. Woods with Public Health, Janine Gordon and Jovetta Whitfield are here from services. Mark Lockhart with EMS. I saw the sheriff. I'm not sure whether the sheriff has additional staff represented on here as well, but we all are available to answer questions, or if you have any comments. Thank you.
Thank you so much, Gudrun, for this incredible report that you just gave us, and this mapping that you've done. It's just extraordinary that you and your staff and partners have put together. And I'm reflecting back years ago with Ellen Reckel and I were, at the conference and seeing some of this, some of the programs, and were able to bring it back. And one of the things that we were about to have a fit about was around the mental health court. And it took us a long time to support you and your team to get that in place. So I thank you for all the work that you've done, you and your team, and all the partners that are on this call. Just a quick question here. One of the things that, you've talked about some next steps that would be interesting for us to take on. Are any of these things that you've seen as far as next steps related to some of the things that some of our community individuals are calling for? When you talk about next steps, are any of them related to the things that they're asking? Could you comment on that?
Commissioner Howerton, I think the efforts that the city is embarking on with RTI and around the call for service and looking at who's law enforcement, the 911, what the calls that are coming in and whether some of these calls can be diverted to non-law enforcement, to clinicians, or whether those calls can be triaged differently than with instead of just a instead of a law enforcement response. I think that is one of it's absolutely exactly what some of your community organizations are asking for. And that is RTI has some funding from the Arnold Ventures to work with Durham County, with the city of Durham, and I think a few other communities, Fayetteville, maybe Greensboro, Greenville, but they have a few organizations, and RTI has been analyzing the 911 calls to see how they can identify them. And so there are I believe there are six pilots or six priority areas that have been identified that they want to test out to see how that could divert a number of calls to other responders, to other responses.
So the city is working on that now?
Yes, ma'am.
Okay. All right, thanks. I'm going to ask commissioners if they have questions. Okay, who's first? Commissioner Jacobs?
Thank you, Madam Chair. And thank you so much for this great presentation, Gudrun, and trying to walk us through everything. It's very complex and detailed, and I think also is a reflection of a lot of the strong investments that Durham County has made in our behavioral health and crisis response system. I also want to note that almost all of these things are locally funded, that, unfortunately, we haven't gotten a lot of support from the state. And Durham County has really stood out in locally funding things like our mental health court and our drug court. When the state funding was ended for drug court, we took that up, and then CJRC is pretty much locally funded. So just wanted to point that out. One of the things I'm wondering about, Gudrun, is I definitely support updating the study that was done in 2019. But one of my questions is that study is very focused on kind of our criminal justice system pipeline and, how we basically keep people out of our criminal justice system and all the diversions and things like that. But I'm wondering about how do we capture other parts of our crisis response system and our other points of contact that people made, because we also want to make sure that everybody is getting connected to the resources that we have, and also want to understand what are the gaps that we have in our system, in our entire crisis response system. And I know one thing I really liked about that former study was it had a gaps analysis. But, when I think about, our youth, our domestic violence system and something about the Family Justice Center, the recent federal grant we just finished with that, where we had a whole pilot with domestic violence specialists who were co-responding with law enforcement, and then actually doing a warm handoff to the crisis response center instead of law enforcement in those situations when they were possible. But just thinking about what are your suggestions though about how we also kind of have a broader look at our system beyond criminal justice?
So for one, I think that a mapping process similar to this could be done in various areas, right? This Intercept map is not unique to criminal justice. It's just that this is what it's used for. But I'm going to take this ball and I toss it to Anne and Jovetta or Janine, because my wheelhouse is criminal justice, and I know what I know what I don't know.
So where to start? I mean, it's a complicated issue and a complicated conversation. And, you know, one of the things that I really like about the sequential intercept for communities is it brings out the importance of data and decision points, you know, and where are you going to invest your money? Clearly, everybody wants to invest their money in prevention and early intervention. We don't want to be a community that just says we have to build bigger jails because we can't control kind of crime, especially when we know that there's some contributing factors of mental illness, substance use, or poverty, unemployment. I mean, I think it is such a myriad of issues that to map it out as simplistic as we can get, and I like to be as simplistic as I can get before it gets harder, but I think that it's not this kind of unilateral or bilateral problem of criminal justice and mental health. I think if we're going to look at that, if we're going to look at access points, where we invest money that we think can have kind of the biggest return and quality of life, it's, you know, how do you take into account when people are homeless? How do you take into account, you know, when people can't earn a livable wage? I mean, it's, you know, like how big and broad and clumsy do you want this to get before you figure out what are those integrated models? What are those funding opportunities to test a proof of concept? And I think that's, we're clearly very interested and very invested in our community partners to think about this issue holistically. And that's one of the things that I really have appreciated about the commissioner's support of our justice involved permanent supportive housing program, because, you know, you can't start this if somebody's living under a bridge. The last thing you want is to send people to a shelter and hope that they make it to an appointment, hope that they, you just hope, and you don't want, you can't pay for hope. And so, looking at kind of these opportunities and what we're really seeing kind of emerge as some best practices of really just penetrating at the neighborhood level. As we've been really thinking about this over the past year and years, how many services do you want us to build? How much methadone treatment do you want to pay for? And thinking that we have shown some improvement in those areas for that particular population. But if you really want to improve quality life, you have to do it in a much more comprehensive way. And so there's some programs out in Denver and even Charlotte that are called the Fuse model that really study discrete populations of who are your highest users of public services. And you start with interventions that are much more tailored around the people that we all have in common. Who are those people in the jail? Who are those people in mental health? Who are those, people in the school? And we did this a little bit many years ago as part of System of Care when we had our top 50 offenders, which I hated that label, but it resonated with people. And we knew the names of the top 50 people who traveled in and out of the jail, who had the highest arrests, and what did they have in common? And then we developed the interventions around what were those common factors, and then looked at what of those common factors needed to be program based. It's labor intensive to do it that way. I think people just want to build up a program and say, oh, you build it and they will come. But I think, the flip side also is worth some conversation of, who are the people traveling through all of our systems, and what do they need? What are they missing? And how can you really personalize some of these interventions and then have that inform a wider community response? So I don't know that that answered your question, but yes, we can.
Mhm.
And how
Yeah.
deep do you want to overlay the
Mhm.
systems that people travel through and get lost?
So
Well,
Anne,
and
before you leave that conversation, you mentioned, given what you just said and the changes that you mentioned that that you're going to be going through real soon around Medicaid, how will that impact what we're talking about?
Well, that's a great question. And I think it speaks to kind of us as a community really understanding who are the people that we're talking to, because, or talking about, talking to and talking about and talking with. I mean, that, because shortly we're going to complicate the conversation even more, where insurance status matters. And so how many people are we talking about that are kind of having the poorest life outcomes, falling through the cracks, not getting the help that they need when they need it, that are uninsured? How many of those are eligible for Medicaid? And what type of Medicaid do you have? And now, who is one of your 5 health plans that could be providing the coverage for your services? And so I think that really does kind of lend itself to a conversation of better understanding who are we talking about in more discrete kind of subsets of the larger criminal justice population. Because pretty soon, in 3 weeks, Durham is going to have to figure that out really quickly with the rest of us.
Yeah. And I just wanted to follow up on what you just said, Anne. I mean, while Gudrun was talking, I was literally jotting down, thinking about all of the populations that we deal with in Durham County departments and all the points of contacts, whether it's our homeless services or DSS, public health, veteran services, in our library, the youth home. We have literally so many different points of contacts into the system. And one of our problems is that people don't know about our services. They don't get connected to them. And then, of course, the people who are uninsured. But then I also was thinking about what you just said, Anne, is about our data and how we really do need the data. Recovery response services gives us really good data, but, behavioral health, walk-in, mobile crisis. We've got a paramedicine program, but it's only staffed by 3 people and really only 1 person on call at a time. But looking at their data, and do we need to expand that? So I think we do need to get a grasp on the current data that we have, mental health court, drug court, and again, identifying, like you said, the frequent flyers, which is what our community paramedicine program has been doing. But I guess to me, this is just saying what you just said is that this is kind of a bigger picture issue. And I just wonder if we need to allocate funding, not only for what Gudrun is proposing, but whether we need to look at something bigger. Plus, Gudrun, is RTI, do they have funding to look at our 911 calls coming out of the sheriff's department? Because that hasn't been done. And do you know if they have funding for us?
I do not know.
Okay.
So, okay, thanks, Commissioner Jacobs. I saw Commissioner Burns' hand. And then we'll move on to Dr. Commissioner Alam after you.
Gudrun, as always, thank you for your presentation. Oh, is it sound? Am I having a sound issue?
I can't hear you. Yeah. Try again.
Well, hold on. Okay, I'll log back on and log in and Commissioner Alam can go. That's okay.
Okay, Commissioner Alam, you go ahead, and then we'll go back to Commissioner Burns.
I didn't actually have my hand raised, Chair Howerton. I was fixing my stuff.
Okay. All right. So Commissioner Long, I'll go to Commissioner Carter, and then maybe Commissioner Burns will be back on Go ahead, Commissioner Carter.
And I'll happily cede the floor back to Commissioner Burns when she returns. First of all, I'm so glad we had this presentation. Gudrun, thank you for just all of the work that has gone into the Stepping Up initiative. And also, I want to thank Commissioner Howerton for that as well. When I first came on to the board, I heard about how we have brought the Stepping Up initiative into Durham County. It was before I was commissioner. And really appreciate, the foresight that she had and the leadership around this, because clearly it's something that our community cares about. And I see Commissioner Burns, so if you want to go ahead, I'll hold with that.
Oh, no, it's fine. Can y'all hear me now?
That's
Okay,
better. Yeah.
Okay, so listen, it's, they got rid of one, they're trying to get rid of the other person that asked too many questions. I'm gonna say, Gudrun, this is probably the second time I've heard the presentation, maybe the third, and I always learn a little something, but I'm gonna leave you alone because I want to focus on Miss O'Shell. Am I saying it correctly?
And
All right. O'Shell. Okay, great. O'Shell, because people mispronounce my name all the time, and I don't like to do that to other people. So, Miss O'Shell, this conversation has been absent your presence. It has. And if it were up to me, you would have been brought in a long time ago. I've heard great things. I've heard that you've presented on this issue on more than one occasion. And I think what I had, my question is kind of two parts, right? So I know that the state created like this LME structure. Okay, good. Getting some head nods. Okay, so my question is, we're sitting here. I think that there's a reason why, people are not connected to services in Durham. I don't think it's necessarily by design. I think some people built some very good intentional programs. I just think that Durham is siloed off, just period. It has nothing to do with anybody on this call. We build some great things, but then we don't go out into the communities that need them. We don't live in those communities that necessarily need them. And then we get into these roles as public service, and then we don't go out and do the work to make sure that the people we represent have access to them. And we all know that has to stop. I know that's not how I lead. And I know that that's from what I've read about you, is not how you lead. So my question is, just for you, since you've been such a leader and your question before, you seem so knowledgeable, what is the role of the LME in the mental health response here right now in Durham? And I ask that because everybody wants to build something new, but if you already built it, I just want to shore you up. So my one question, what is the role of the LME in mental health response? I'm gonna let you drive the car now.
Sure. So that's a big question.
Look, we got time. We have time. Let me tell you, I'm gonna go back because they had time for everybody else. So you take your time. They had time for everybody else except for the practitioner.
I do, because I really want Durham to get this right. And because there's great opportunity to think about it differently, and to behave differently, and to put potentially our money in a different kind of place. And that's not to say that we don't have really good things that are working. And that's not to say that there are some key things that are missing. And so the LME responsibility in our communities, we grew out of the Durham Center that was a county department. And at that time, so I've been in public mental health 30 years. I've seen a lot of things come and go and this and that, and and we're in some pretty turbulent times. But one of the things that's very clear from an LME perspective is it's, Alliance's commitment as part of our roots of the Durham Center to ensure that the citizens of Durham County have access to behavioral health services when they have no insurance. And that's our commitment. And we think about that we have to think about that in some really creative, innovative ways, because as the commissioners know, we come to you every year for funding. And part of it is because, the state doesn't fund all the things that we think are necessary to reach the community goals of everybody kind of having access to care in an equitable way, having the right level of service at the right time when they need it. Our goal is to always divert people from coming into treatment through the 911 system and divert people from coming into the system in crisis. And so, as we think about this, You know, our goal is to always say, like, if we're here, somebody's already in crisis, they didn't have access to their medication, they became homeless, they lived in substandard housing. What could we have done 10 steps before that to avoid somebody having to go through the trauma of just major life upheaval? And, you know, and so there's more work to be done about how we think about that. And I think the way the world is coming out of a pandemic, where we're just starting to see some of the long-term consequences to COVID-19, you know, the larger world issues of everybody thinking about kind of how do you know, what does wraparound look like? And I think that your question is even more pertinent to the conversations now, because one important thing to remember about the mental health system, you know, we're clumsy. You know, you start here and you got 10 steps before you actually see a psychiatrist. You know, we have a behavioral health urgent care center. We've done a number of things to really streamline so we don't lose people, you know, when they're ready for help. But the other kind of consideration for any mental health service, any substance use service, unless a person is a danger to themselves or others, they have to be willing to accept the help. And they are voluntary services. And so that, you know, for the work of Alliance, and especially kind of as I think about our role with community partnerships, is that means, you know, we always need to make sure that we have capacity in services. And Gudrun and I have talked for years, and, you know, and she's right. And sometimes I avoid her because I know she's right. And I don't have a good answer. If you've got somebody in the jail that's uninsured and they need our highest level of treatment service, which is an ACT team, and we're saying we don't have the money to pay for that, then what other options are there? There's terrible options for people other than we're going to release them best we can, and they're going to end up back in the jail. And so we think about kind of all those other ways to begin to engage people wherever they are in their life, even if we know they have schizophrenia. What are some of those other ways that we can engage them, you know, to help, you know, prepare them for treatment? And that's through housing. That's through meaningful neighborhood relationships. That's not, you know, and I'm not going to be long-winded about this for the sake of time, but, you know, we were very involved in the relocation of the families at McDougall Terrace. And one of the things that we learned from that experience, which we already knew, but it took that experience, and then it took COVID just to hit us up the side of the head to remind us again, people are just, when you're depressed, when you're anxious, when you've been exposed to trauma, they're not going to just think at that time, oh, what's that Alliance number? Who can I call? They're going to think of somebody to call. And, you know, and as much as we can put kind of the people in the places to help them navigate, to me, that's a much better way to go than to have this kind of passive approach of just, you know, waiting for somebody to call or waiting until we think they're ready. So I know that's kind of a roundabout, but as an LME, you know, our commitment is to ensure that people that don't have the entitlement of Medicaid have the same access to services and supports as anyone else. And then it becomes such a funding limitation in order to do that.
That's really helpful. And I just want to say this, I'm happy you put it that way, because if you frame it that way for me, I don't know how everybody else heard it, but it seems that you and Gudrun have an awesome command. First of all, when you said the Durham Center, I said, oh, well, this has been a long time coming. I think there are people on this call who don't even remember the Durham Center. But you have a command for this subject matter and for the work that needs to happen. So we all know, I know that I see a couple of folks on here from emergency management who are on this call, from the sheriff's office who are on this call, and they were on here earlier this week. And you know what the conversation in the community is like, right? You know, and you haven't been a part of it. So my apology. Well, I'm not going to apologize. I'm happy you're here. It's not my fault that you haven't been brought in before now. What I want to kind of sort of center it around is, so you're basically saying, because by the time somebody gets to law enforcement, 10 has happened. You're saying that your volunteer services are available when people are at 4 or 5. But right now, from an infrastructure standpoint, you don't have what you need to educate, inform, or to pull in and do the outreach so that people know at 4 or 5 that you are there.
Yes, I think, or what is the most appropriate for them. you know,
Right.
Alliance may not be the most appropriate resource for them.
Right.
There could be lots of other things that where people are doing really great work that may be more appropriate. But
That's helpful. Go ahead.
No, I was just going to say, but that coordination at that time that somebody has somebody in front of them to say, you know, what do you want? What can I help with? And, you know, and what's it going to take to get you there? I think some of that is missing in the conversations because we say, we've got this over here. I'm going to give you this phone number and, you know, and can you call?
And you all get state, last question, you all get state and federal funding? Yes, no, some?
We are entirely publicly funded through state and Medicaid dollars and local dollars.
Thank you, ma'am.
So Commissioner Byrne, that took me back for a while. So I was here when this whole alliance got created. And so you took me back a while and brought me back to where we are presently. So when Alliance got started, commissioners across the state, including Durham and across the state, we didn't have a clue. We didn't have a clue what we were supposed to be doing because it was new. And sometimes I think as commissioners, we still don't have a clue about what Alliance does. We know a little bit, but it really takes commissioners really giving it some attention and time and asking the questions. And Commissioner Carter is on that board, so she probably has a little bit more information than most of us as commissioners, but it really takes time and energy to learn what Alliance is responsible for. So I just want to say thank you, Anne, for all of the time and energy that you've invested in being able to share with us what Alliance does, because I don't think many of us know what it does. I'm going to go to Commissioner Carter.
Thank you, Brenda. I think you're so right about not, you know, I feel like I am on their board and I struggle to keep up with just all the different aspects of how the LME MCO system works and what's happening locally, what's happening that's funded through the state, et cetera, et cetera. And I totally agree with Commissioner Burns that we have the person who is the most in command of this, who is accessible to us, and that is, you know, Anne. In the same way that we have the person that's very much in command of the subject about what we're doing to prevent people from entering our criminal justice resource, you know, our criminal justice system and all the resources that we're working on with the community towards improving all of the different points of intercept on the map. So one thing that Gudrun said that I really agree with is that we want to continue to populate our map, and we know that we are. And I love the recommendation that really aligns with something that I think Commissioner Howerton has said all along, that we really need to, you know, update our map. And so I think maybe all of us are in agreement on that. And especially I think we need to update it and populate it more at this Intercept 0, which I hadn't really seen before. I really like Intercept 0 and Intercept, what I'll maybe refer to as 0.5. It looks like there's some crossover there, you know, between community services and law enforcement with the 911 system and with local law enforcement. And I feel like that is where the community is asking for some change, is at that Intercept in particular. I feel like what we all are interested in trying to do is increase funding for mental health. And there are various ways we could do that. And there are various places to which the increased funding could be targeted. And we will absolutely need the, you know, advice of our own county staff and the advice of Anne and Alliance and Gudrun and basically all the stakeholders maybe that are part of that stepping up in infrastructure to figure out where do we want to increase our mental health funding. But, you know, it could be more ACT teams. It could be in the paramedicine program. It could be more money for behavioral health urgent care. I don't think we see everybody or can see it could be more money to go towards people who are uninsured, because the state is probably going to cut that funding yet again this year. It could be more permanent supportive housing, right? And increased street outreach. And we might even want to, bring ARPA funding into that discussion. So there are a multitude of ways we could use the money, and we want the help of our expert allies to help us target it. Another source of funding, though, and another area that I think the community has an interest in, is decreasing encounters with armed law enforcement by having a different model, in particular for behavioral health crisis response. And I think we all are interested in doing that too, because we know that it's the Black and brown communities that have experienced the most harm through encounters with armed law enforcement that have turned into a situation of an overuse of violence. And sometimes that's based on racial bias. The system has it built into it. So I think our community really is asking us to take a close look at the model. How can we decriminalize behavioral health challenges? How can we decriminalize poverty? How can we decriminalize homelessness? And I like the idea of trying to test a proof of concept around this kind of different crisis response model. It might already be one we have. Maybe we could scale up the paramedicine program, and it would be non-armed law enforcement responding to behavioral health crises. So I guess I would ask our staff and my colleagues if this is something you'd be interested in. If, trying to respond to our own values around this, trying to respond to the community, if we could ask the sheriff, who seemed really receptive to collaborating, like he really wanted to collaborate with the community on this, could we consider a freeze on a certain number of positions for armed law enforcement until we have determined, what the model for response would look like that was a different model, and, how many people it would need, and the infrastructure, and just the full plan. And at that point, we'd have some funding we could then sort of reorganize based on different duties. We could reorganize the duties of the law enforcement so that they would now be unarmed responders that have behavioral health specializations. And that in turn should free up more time and perhaps even funding for for combating the violent crime that we know is on the rise. So I guess I would just, I'd like for us to look at both sides of the request, the increase in mental health funding and decreasing encounters with armed law enforcement through a different behavioral health crisis response system. And could our staff, working with the sheriff collaboratively, help us with that?
Commissioner Howerton, could the sheriff answer since she asked the question and he's on screen?
Sure. Go ahead, Sheriff. Burkhead.
Yeah, thank you. Thank you very much. And Commissioner Carter, to your question, and also to the narrative that you laid out, I am absolutely supportive of a co-responder model. I don't think it necessitates freezing law enforcement positions, particularly here at the sheriff's office, when we're already struggling and short-staffed. What I would recommend and certainly applaud is if we use some of the federal funding that's coming down, either from the CARES Act or the Recovery Act. There is no shortage of funding for this particular item at the state and the federal level. I think it would be counterproductive to take funds from law enforcement, particularly when we know that last year we experienced almost 1,000 shootings. Over 129 individuals were shot in Durham, in the Black and brown community. We had 37 homicides. We need to be responsive to the other crisis that is at hand, which is gun violence. And we know that there's a correlation between opioid use, abuse disorder, gun violence, poverty, all of those things that we've talked about here today. So I absolutely do not support freezing positions or taking 10% from my budget or to fund this. I'd also like to point out that Ann and others and we have a great relationship, and we've been attacking this issue together for as long as I've been sheriff, and even before. Even Commissioner Jacobs can agree that in 2014, we sat on the Durham Joins together and started this conversation about mental health and how do we respond to some of the grassroots and some of the core issues that are certainly fueling this crisis that we're experiencing. And at that time, the conversation about defunding the police was not brought up, and I don't think it should be brought up now. I think this would be a mistake to freeze law enforcement positions at this particular time. But I'm happy to have the discussion. As you all know, law enforcement has been excluded from being in those discussions with the Safety and Wellness Task Force. And I think that's a mistake. When you start talking about a co-respondent model, law enforcement is at the center of that. When you're looking at 911 data, law enforcement is at the center of that conversation, helping to create opportunities to be creative and have folks responding to these calls, these crisis situations with support of law enforcement, but not putting law enforcement out front. That's exactly how the CAHOOTS model works in Eugene, Oregon. Everybody talks about that. That's housed in the police department in that community. So let's not get caught up in the rallying cry to defund the police. Thank you.
I really don't want us to get caught up in that. I agree with you. And I believe that this is such an important community problem and so complex that it really is going to require us, not calling out police or officers in a punitive type of way at all, rather calling in and figuring out how to change the model. And I appreciate the fact that you're open to that. The one thing I perhaps differ, but I want to keep learning more about this, but I see it as freezing a position that's unfilled and then filling it with a behavioral health specialist that would then not require a law enforcement responder. So it would be reorganizing the duty, away. That's the only reason. I'm not interested in gutting your budget, Sheriff Burkhead. I think that you are a progressive sheriff leader in this state. And that's why Durham for All and the People's Alliance and others, endorsed you and helped you get elected, helped me get elected, is because I believe that you're a progressive leader right there alongside of us. And, this is just a value that's out there in our community. It's a nationwide discussion. Like we talked about the other budget work session, it's super complex because we also have pervasive pandemic of guns. And so I really kind of want to turn it over to the stakeholders that are part of that Stepping Up initiative, which you're part of, I think, Sheriff Burkhead, as well as Alliance and just all the other partners, and working with our new Safety and Wellness Task Force to help us figure this out. I personally would be, receptive to shifting a few positions by way of a reorganization of duties, because I feel like that would free up our armed law enforcement then to fight real crime. So I'll stop, but I would ask our maybe she can help us kind of draw all this together.
Yeah, I'd just like to respond. Commissioner Carter, you're right. I'd also like to point out that all of the the very tragic incidents that we're seeing play out on the media day in and day out, we haven't had those in Durham. We have one of the top law enforcement leaders in a police department, in Chief Davis. She spoke before Congress on this issue. Unfortunately, she's leaving us for another jurisdiction, but we haven't had those issues. She has trained the men and women and set the example for the Durham Police Department, as I am doing here at the Durham County Sheriff's Office. We are partners in this, but what we cannot run from are the other issues. And again, whether you take a vacant deputy position that I'm trying to fill just today, hosting a job fair out in the rain, where we had men and women coming up, filling out applications, is not the approach that we should be taking. Again, when funding is not the issue, we can be a little more creative and not trying to take money, again, to satisfy a particular group or a particular organization who wants to defund the police. Again, that's just not the look that we should be taking on here. Certainly not the approach we should be advocating for here in Durham County.
Commissioner Burns?
Oh, well, the only question I had, I didn't have my hand up because I know we were up under hour. I did see that Ann came off. I guess where I'm coming from, just a few things. When I looked at the commitment that was made, the unlawful commitment, because they had a quorum on that call a couple of nights ago, and that we did not do that. One of the things that I want to point out, if we're just looking at this thing from a mathematical standpoint, and we're also, it's the same conversation that we're having about the nurses and the teachers and our ability to scale up. So I just want people to take a step back and think about it practically. The city was asked for 60 positions. They pushed and pushed and pushed until it got to the point where they had to give 60 positions, and then they said 20, and then on the night of the vote, they gave 5. So they didn't even give 10% of what they said. I see you shaking your head. Let me, I know they said up to 15. Commissioner Carter, please let me finish. One of the things, you didn't say anything, but people can't see you're nodding your head and you're shaking your head. So, but I'm not gonna waste time with you telling me I'm wrong. So one of the things that I want people to understand is they offered 60. They came back and said 5. That very same night, 5 people. Nobody on this call is talking about the fact that Black and brown people are peeled off the ground every day. I have not seen, I know a few of you have, I have not seen some of y'all at these rallies. I haven't seen you at the funerals. I have not seen you sitting with these mothers. I have not seen you at any of these gang disconnection rallies. There's 2 issues going on in Durham. There really seriously is. There's 3. And I think Pierce Freelon even mentioned them a couple of months back. We're dealing with a pandemic, and it's for an economic downturn, an issue of gun violence, and an issue of racism. And it's hard to hear people who have an issue of racism talk about let's end the racism. It's hard to hear people talk about how we need to focus on one issue, as if dead Black and brown bodies in Black communities don't hurt us just as badly. Like it is, like we are literally tired. We've had that gunshot broken into multiple times, and I'm getting off my point. I'm gonna get back to my mathematical analogy, because again, they only and y'all can text all y'all want to, they only gave them 5 positions. And so that is, again, 10% of 60 is 6. So 5 is less than 10% of what they asked us for. They asked us for 10%. I'm not saying that we have to give them 300. I'm not saying any of that. I'm saying that this department is not developed yet. I'm saying that Ann already has a department that does that. I'm saying that we can actually not argue, but we can make the statement that this department, just like the social work department, just like the nurses, has to be scaled up. Now, the sheriff has already said that he's open to it. Sheriff, I hate to do it like this, but quickly, yes or no, if we sent you some options, would you be open to looking at them?
Yes.
That's an easy thing. See, none of that has happened before. Y'all wait to get to cameras and after the budget to talk to folks. And it shouldn't have been done like this. Everybody on this camera knows it shouldn't have been done like this. The reason why I sit on the Health and Wellness Task Force, and I've been talking to folks at Behavioral Health, and I've been talking to folks in law enforcement, because I want this to work out. So every time we get on camera and then folks want to bandstand and say, oh, well, I care about this and I care about that, like, prove to me that you've actually put in the work over 6 weeks to remedy this issue. And Commissioner Howerton, the perfect example, I saw an article the other day said that we didn't care about the tax plan. Soon as the tax plan came out, when we were working on when we were on the campaign, many Black people sat in a room, 10 of us sitting there and told y'all it wasn't gonna work. We didn't say it was a bad idea. I think it's a great idea that y'all care that much, but we knew it wasn't gonna work. We knew it legally wasn't gonna work that much. Commissioner Lawman I got into office, and we said, okay, who in North Carolina has something like it? Charlotte has something like it. We put in the work, we went to Dwayne, we went to Joanne, we said, okay, let's figure out how we can make this thing work. And here it is, a year later, we got 3 times as much money as Charlotte. We have a higher amount than Charlotte, and we have a higher LME. Like, that is what it takes. That's what it takes. And the thing is, through this whole process, None of that has happened. Somebody lied in the newspaper yesterday and said that we didn't do the tax plan. The tax plan right now is in the budget and everybody here agrees on it, and it's 3 times as much money. And guess what? We're doing it in a legal way. All I'm saying is if we can do that for a tax plan, we can take the time and make it right. If we can do it for our teachers and our social workers, take time. Why can't we do this? I feel like there are folks out here who know they have a bad reputation and they're like, let's just throw this out here and make this group of people happy so we can clean up our reputation. I don't want to do that off the backs of Black and brown bodies, especially when I'm the one that got to see them dead. When I drive home, I got to see the lights. I got to see the bodies. So I'm not saying anything's a bad idea. I'm saying we have not put in the work. It's clear from this conversation and every conversation we've had this week. So Sheriff, I'm hopeful if these people really care about what they say they care about, and we're looking, even the city decided that making that promise wasn't the best one. And they might go up to the 15. They said up to 15. I don't know what they're going to do, but that department's not even built yet. The LME right now is set up by state statute. Evictions are set up right now by state statute. You had a guy to go and serve an eviction the other day, and what happened? He got shot in the leg. So you do have the, I heard somebody say the other day, there's no legal reason why the sheriff's department or the police department has to give out tickets. Actually, there are statutes on that. We have got to educate ourselves, y'all. That's all I'm saying. So if we can take why is it when it's a Black issue, we rush? Whenever it is a Black issue, we rush. And I'm gonna stop there.
Madam Chair, I also wanted to talk about the funding side of this because another option for the, I'm sorry. I wanted to just make everybody aware of something I just learned as an Alliance board member, if that's okay. Despite the beratement, I actually with Commissioner Burns.
Commissioner Carter,
yes.
We're gonna have to move on. Can you take 2 minutes to say what you need to say?
I can take 2 minutes very easily.
Please.
Yes, I don't believe I'm one of the ones who talks an excessive amount. Yes.
It's me and Wendy. I'm okay with that.
Alliance just realized, or I just realized, I'm sure they didn't just realize it, but there was an email that came through and I was copied on it since I'm on their board about an additional basically $1 million of funding that we might be able to use for increased investment in some portion of the mental health system that we are guided by OSHA Alliance, our own staff, people from the Stepping Up Initiative. And so I just wanted to ask maybe Claudia and Ann, I don't know which one, but is that an option for us here as well?
Before Claudia answers you, Commissioner Carter, I want to say this. OSHA, which is an expert, Gudrun, both have said to us that we need to do the analysis, we need to do the mapping, we need to do so that we can be guided by data, that we know where we need to target, rather than what I'm hearing is our commissioners want to start at the back end versus starting at the front and do the work so that we know where we need to direct our resources. Are we just going to we're just going to throw money at what we think without being driven by the data? That seems to be what I'm
No.
Let me finish.
No, I don't want to do that.
That's what I'm hearing here, because right now we have no analysis to say where we need to start. And that's what I've said from day one. It's like, where is the analysis to say, where's the mapping that tells us what community do we need to start at? Do we need to start at an area? I'll give you an example. I'll give you a real life example of calling someone, trying to get someone to help a friend that had her daughter and grandchild had been murdered, and she didn't want to live anymore. So I'm calling around trying to figure out, what do I do to help her? And I was finally able to get into touch with someone that told me what to do, but she refused to call them. I had to go and sit with her and call them so that she wouldn't take her own life. Now, as a commissioner, I didn't know where to call. I just kept calling numbers until I got somebody. But that is the kind of information the community needs. Now, that didn't create the need to create anything else, but she didn't know where to go. I didn't know how to help other than to continue to call. So what I'm saying is, let's do what we need to do up front before we start to throwing money at stuff. Claudia, go back to you. You had something you wanted to say.
Please, I want to clarify. I have never asked for the money to be spent tomorrow or the day after we approve the budget. I'm just saying there's $1 million available. We can invest it in the mental health service that Ann Oshel, Alliance, Claudia Hager, the sheriff, people, Gudrun, people on the Stepping Up Initiative help us to identify as where it should be spent. But I would like for us, and I would think we would all want this, for that money to be in the budget so that when we do know where to spend it, when it is identified for us, we'll have it. That's all. I agree with you, Chair Howerton. We want the study. We need an assessment so we know where the gaps are. I agree with you.
Commissioners, this is a tough conversation.
It really is. It really is.
It is complex, and it just sort of speaks to the need of the framework that's been outlined for us to continue to peel the layers of the onion so everyone can understand, but so that also we can invest in the areas that we know based on the evidence and the data where there are gaps. I know all of us have stories about the importance of mental health services and behavioral health services and the impact when they are not there. The Alliance in their budget this year, because of the pandemic, COVID, and like the county, other county departments, they have approximately about $1 million that they normally would spend for services that they're requesting that those dollars roll from the current year into the next fiscal year so they can help in that space. Typically, they always spend their dollars. What we're proposing, and it's on our add delete list, which we'll talk about later, is that those dollars are allowed to carry forward to continue supporting our mental health and behavioral health spaces. And we can talk about that a little bit more later, but we did have that on the list as an area of how we can continue an investment of dollars that we've already budgeted and help the community in an expanded way that we weren't able to do this current year because of COVID, and Ann can weigh in on that.
So I would agree. And I do think this is such an opportunity, and it's such a complex problem, and it's not a problem solved by any one system. And so I would draw on what Durham does best, and that is collaborate with each other, and really, get all the people in the room, including people who would be the recipient of whatever help we determine is needed. Because sometimes we sit insulated and decide kind of for people what they want, and then that's not really what they need. And so I think, I agree with Chair Howerton. I mean, I think, and what we would appreciate is there, this is such a heavy issue, and it's so important to the community and to our most vulnerable citizens that we allow enough time to understand what it is that we need to do now and what it is that we can do in the longer term. You can't do it all at once and do it well, and you don't want to mess it up to begin with. You really, you wanna figure out kind of where and who and how that money is best spent. And, you know, everybody has ideas, and, you know, Gudrun brought forward some great ideas, and we would not disagree with any of those ideas. I think they just need to be explored in a much more kind of intentional way. And there is money available. And I mean, I am not speaking for our CEO. So, but this is an issue that's important to Alliance. You know, obviously we want people who are in need of treatment to find their way to treatment, and not have to go through some unnecessary hospitalizations or other things in order to get there.
Thank you, Ann. Commissioners, if we can move on to the next item. If there's, Commissioner Lom, you have something?
I just had a quick question, if that's okay. It was just a follow-up of something that Commissioner Burns had brought up that I just wanted clarification from either her or staff of, because I think there's also confusion between what the city is currently proposing and versus what it would look like on this county side. So Commissioner Burns had mentioned, like, you know, with the city, what they're doing is creating an entirely new department. And with the county, like, we have Alliance Health and other entities. And I was just wanted to get clarification from staff with not of like the work that we are going to do of increasing funding for mental health services. It would be through the partnership of the current LME that exists, right? Not the creation of a new system. Or would it be the creation of a new system like the city is doing?
I'd like to hear that question as well, because the request is for us to send money elsewhere. I'm so happy. Thank you for asking that, Commissioner Long. I'd like to get clarification on it.
Claudia?
Yes,
Yeah.
From my perspective, the work has to happen to evaluate where the gaps are. We have an infrastructure in place to meet many of the needs that are currently there. Ideally, you would want to bolster current infrastructure to meet those gaps, because you have economies of scale, you can ramp up faster. But if in the assessment, there's an identification, we need to approach infrastructure different, then that's the opportunity that we will look at bringing to the board. From my perspective, ideally, we would look at how do we bolster what's in place. But if we're trying to look at best practices, look at innovative ways, the end result may be something different. As someone who's a policy person, I always am cautious about sort of saying what the response will be. But in my perspective, we want to try to bolster what's in place, because Durham has so many innovative approaches that are envied by many places across the country. And so with that, I think we're ahead of many entities as when we look at how we do behavioral health. But we know there are ways that we can improve as well. So and others may choose to weigh in.
Thank you.
Okay, thank you. And Gudrun and all of you, Sheriff Burkhead, all of you that's been in this conversation, thank you so much for your input. And we are going to move on to the next item.
Sorry, Chair Howard, if I could make a quick announcement to you as well as the commissioners.
Sure.
Manager Hager, we have lost power in admin 1, so the meeting is not live on the website. We are still live on YouTube. So we will take the recording from YouTube and load it back up to the website. I have contacted General Services, as well as I just sent an email to Perry and Jim Ferris regarding the construction. So we're hoping to have that up and going. I do have David Ades and Keith Lane as co-hosts in the event that I am booted off because of the power. So I just want to let you guys know that we will keep going. And once we do get power again, I will make an announcement.
Hey, Monica, this is Perry. I just want to say that the power is out everywhere downtown. So it doesn't have anything to do with the construction. I'm an admin too. It's out over here as well. So.
Oh, wow.
Yeah.
Okay.
Well, if you come down to CGRC, we still have power.
Yeah, we have power. We have power in public health as well.
Okay. Thank you, guys.
All right. All
So
right,
does the sheriff's office.
Okay, so the next item is 210366 on minority maternal health infrastructure. County Manager Hager, you want to take us here?
I will transition to our Public Health Director, who will share with us about current efforts as it relates to Black maternal and child health. And also General Manager Joanne Pierce may also weigh in as well.
Being the gentleman that I am, I'm going to allow General Manager Pierce to go first.
Well, thank you. I appreciate that. Good afternoon to the commissioners, Attorney Darby, Manager Hager, and to those viewing. I'm Joanne Pierce, General Manager for Health and Wellbeing, and I'm joined for this discussion with Director Rodney Jenkins and also Ms. Hattie Wood, Director of Nursing at our Department of Public Health. Public Health provided a document as an update of what they are doing in this space and are here to entertain your questions. First, I must thank you for your request for information about what public health in coordination with community and state partners is doing around the maternal health disparities, particularly as it relates to Black women and the outcomes we see when it comes to mortality rates and other issues. Unfortunately, tackling disparities in maternal health is a longstanding national, state, and local issue, which tells us that the issue is systemic and structural in nature and beyond what individuals can do on their own to address the problem. We know that effective diagnosis of a problem determines effective treatment. In my recent past, I've had the opportunity and pleasure to serve for a few years on the state's perinatal task force, and they used Dr. Michael Liu's 12-point plan to close the Black-white gap in birth outcomes, which is a life course approach. And Dr. Michael Liu is a neonatologist and researcher by practice, and he asserts we must look beyond initial short-term solutions and move towards structural change for the most impact. And I'd like to highlight a few of the 12 points, and I want to highlight those because you'll also hear the activities around what public health is doing. You'll hear these again because they are truly implementing those things that we need to do to address the issue at the local level. And so, as you might imagine, the 12 points would include providing interconception care for women who have adverse pregnancy outcomes, increasing access to preconception care to African American women, improving the quality of prenatal care. And then they go beyond that by enhancing coordination and integration of family support services, investing in community building and urban renewal, closing the education gap, and they say reducing poverty among African American families. And how about we just eliminate poverty among African American families and also support working mothers and families. And the 12th point of this 12-point recommendation that Dr. Michael Liu and others use is to undo racism. I'll leave you guessing which task force or group they put me on when I served there. So we know that, the multi-pronged and cross-sector approach is really the work that was required to address maternal health disparities. And we know that there is much work to do. And I'm reminded of a famous athlete's story about her experience when she gave birth a few years ago to her daughter. She talked about not feeling well following the birth of her child and sharing her symptoms with healthcare workers in the hospital. And understanding her own medical history, she stated to clinical professionals that she needed a scan and a particular medicine to address her immediate health issue. She was dismissed as perhaps being somewhat disoriented following the birth of her child. And after she insisted, the medical issue was indeed identified and addressed. So we know that access to healthcare, insurance, and resources were not the issues for this individual. However, it speaks to perceptions and treatment at the systems level. And so before I turn over to Director Jenkins and Ms. Wood, in closing, I would like to finally say that if our focus is only or primarily about developing new programs, initiatives, or services, and not also examining our systems, institutions, and policies for change, individuals will continue to enter our systems and institutions at an uninterrupted rate, widening the racial and ethnic gaps because we would not have addressed root cause issues. Our solutions are perhaps not what we always do, but what we are courageous to do differently. I turn it over to Director Jenkins. Thank you.
Thank you very much, General Manager Pierce. And I dare not get in the way of my Director of Nursing, Hattie Wood, who has been in the trenches working tirelessly with this subject for a number of decades. I didn't say years, I said decades. But I will say that my tenure, my rather brief tenure here in Durham has been mostly directed toward the fight to end COVID. But make no mistake about it, maternal health is something that I'm very passionate about. It's something that I championed as a former Deputy Public Health Director in Cumberland County. And we realized that, as General Manager Pierce has indicated, it is a systemic issue. And it's nothing foreign to Durham County. With that being said, we think it not an accident that the director of the Office of Minority Health, Mr. Cornell Wright, is a member of our local task force, and he's also a resident of Durham. He attends Born in Durham Healthy for Life meetings regularly. And that's just to emphasize how severe and how serious this problem is and how we are working tirelessly to try to get this thing resolved. I hope and I pray that you've been able to really take a strong look at the document that we created. I'm very proud of the staff, primarily because as we continue to circulate in hopes of producing a document to your pleasing and for your edification, it was just so enlightening to know all that we have done over the course of the years around this very topic. With that being said, I'll just pass it to Director of Nursing, Ms. Hattie Wood, for additional commentary.
Thank you, Director Jenkins and General Manager Pierce. Good afternoon to the commissioners, attorneys, and Manager Hager. I've had the honor, and I'm very grateful to be a Durhamite. I was born in Durham, went to undergrad nursing school in Durham, and also worked at the local hospital where I was actually born. And I had the wonderful opportunity of working in that maternal health program for over 7 years. And I worked with the uninsured and underinsured for private diagnostic clinic. And during that time, the clinics were separated. So I worked in the residence clinic. And I was the charge nurse in that clinic. So I've had that wonderful opportunity. And then I made a decision that I would like to come to public health to work, to give back to the community where I grew up in. And I had no idea when I came here as a public health nurse, one, that I would end up as a director of nursing. Having said that, I've also had the wonderful opportunity to attend the annual and yearly Maternal Child Health Epidemiology Conference, which moves from state to state. And that's one of the trainings that the director of nursing attends, and my predecessor attended it, and I've been able to go to that conference every year as well, serving in this capacity. And it was during that conference that I really got even more engaged in maternal child health efforts, and also disparity of infant mortality as well as Black maternal mortality. It's just, I remember saying to someone, I wish I had been a lot younger when I had taken up this cause, because I feel like I could have done even more work and put forth even more of an effort toward this disparity in this program. One of the things, if you read the document, is that I am very honored to serve with Dr. Maria Small as a co-chair of the Born in Durham Healthy for Life, which is an offset from the first program that started with previous Commissioner Reckow. And this is an outgrowth of that program. And Dr. Small is also a Durhamite. She grew up in Durham, and she had the wonderful opportunity of, I noticed, of graduating from Jordan High School, whereas I graduated from Durham High School. So we have that common cause. And if you read the document, you notice that what Durham and Born in Durham Healthy for Life is a community-based organization. And like Director Jenkins said, Cornell Wright from the state sits on the committee. We have various health insurance vendors that sit on the committee. It's a partnership, a collaborative effort. We have numerous programs like the doula programs, the Mamas program that sits in. We have volunteers. We have students from all of the local universities that volunteer to sit on the committee as well. We also have some of our staff here. Our child health program manager, Cheryl Scott, sits on the committee, and we have numerous partners from Duke Community Family Medicine and Duke as well, and NCCU, UNC. So we're very happy to be, and part of what, like Dr. Small said when she prepared an article when we're being interviewed for BIDHFL, is that we seek to work with partners if there is an issue when it comes to maternal health for Black and Brown moms and receiving services and care. I can cite one instance where there was a program during COVID. One of the major hospitals was only allowing the doulas to be in there for a short period of time with the moms. You know, doulas just advocate with the mothers so that they can express what their concerns are. They don't tell them what to say, but they do. They're there with them when they go in for labor and during the birth, and they were staying with them immediately postpartum. And this local hospital was sending the doulas out and saying that after the baby was delivered, you know, you could no longer be here. So we worked across the divide with the organization, with the representative on our committee who works at the local organization at that level, and they were able to allow the doula to stay the entire time. That way the needs of the mothers were being met, and they were not telling them they had to leave after the baby was born. And so also, if you look at the document that you receive, you can see that how across the entire department, there is a universal effort to work on maternal health. I'm sorry, I'm in the COVID clinic too, vaccination clinic, so I'm kind of like monitoring two areas, so excuse me. I see someone making an announcement. I think they're talking about the weather. It's the EMS and he's making, so I'm sorry. Anyway, so having said that, so if you look at the document, like I said, you'll see that we, across the department, there's a department-wide response. I started the document with the opportunity of looking at what the maternal health program does itself, because that comes up under, you know, my purview as the director of nursing and division director of medical services. But in addition to that, I know that nutrition has a vital role when we talk about what there's several causes of Black maternal morbidity, may be obesity, as well as nutritional efforts, whether or not they're getting adequate nutrition, and then their BMIs. And so the nutrition director put in what they're doing for the response. Then we also put in our health education component. They have a maternal child health grant that we share to provide the services. We also have a huge connection with Family Connects, which used to be Durham Connects, and the commissioners actually fund, Durham County funds a part of the budget for Family Connects. And so, and that's what the program I'm sure you're aware of where the mother is seen. Every mother that delivers in Durham County receives a visit from a nurse when they go home, and they also do an assessment on the infant. And then if there are more resources that are needed, they link them to the resources in that. is one, this actually started in Durham County and it has made national attention. And it has gone worldwide as far as this program. And so far, that name is called Now Family Connects. So these are just some of the efforts. And if you have questions about the document that you received, I am happy to try to respond and answer any of those about the services that we're providing here at the health department and across our department to combat this. One thing I'd like to say though, that when I first moved into this position as a director of nursing, one of my roles I found out was to track maternal, infant mortality, because if you realize that infant mortality depicts what the health of the community is based on your infant mortality rate, that's a deep reflection upon the health of your community. And so, and I remember I moved into this position in October, and so that the spreadsheet of all the infant mortality rate was behind. So I took the liberty of working on it, after hours and on weekends. And I can let you know with a surety that there were times I often had to close my computer and walk away from that document and walk away from reading those death certificates, because the impact that it had on me was severe. It took me a while to come out from under that. And so I wanted to know exactly what it is I can do as a person to help combat this problem, to alleviate some of this. And I've always said in my career, having been a nurse for almost 40 years, if I can affect the life of one individual, I know I've made a difference. So I'm welcome to entertain any questions you may have.
So thank you, Dr. Woods, Manager Piers, and Mr. Jenkins for this report. This is dear to our hearts as well. During our budget presentation, Commissioner Burns brought up this conversation that this is one area that we needed to take a look at. And then at one of our meetings, I had asked Director Piers and Deborah Craig Ray to begin to organize the members that were already participating to see what is it that as a board that we need to take on. So I don't think you may have come today prepared to tell us what it is that we need to do as a board to undertake to support this. But if you have anything that you'd like to say, or if you'd like to think about it and come back to us, either way, we'd like to hear from you. What do you see that's missing? Because the other thing is, I've been on calls across the state and listening to women talk about the horror and the pain that they've endured around this subject. So I'd like to hear any recommendations that you may have for us.
Madam Chair, we are grateful to the board for taking up this very important topic. My team and I, as you well know, we don't have a whole lot of asks in public health, particularly for this particular fiscal year, because you guys have been so good to us. And we know how to be good stewards of the dollars that we receive. But rest assured, we will do some internal brainstorming. We will talk with our partners with Born in Durham, Healthy for Life, just to determine what else their needs might be. And, we will more than certainly get back with this board with some recommendations. But as I aforementioned, you guys have been very good to us over the years. And we have been able to do some marvelous things with the resources that have been received. But knowing you all, you like being first and cutting edge and making sure that we're forward thinking. So we will be more than happy to really give some more thought to this.
Thank you. I saw Deborah Craig Ray pop up, Deborah, and then I'll go to Commissioner Burns. Yeah.
Thank you, Chair Howerton and Commissioners. I met a couple of weeks ago with Hattie Wood and Dr. Maria Small, and they basically gave me a Cliff's Notes on the tremendous work that they have been doing for years in our community. I was impressed. I was overwhelmed. I was proud. They really have dug into this challenge, and they are doing some really significant cutting edge work. And so I promise to get back with them as I continue again to do what you do, is share and talk with some of our colleagues across the country to hear some other types of best practices that are going on that we might be able to bring back to Durham. And so I am still doing that work. But again, we are aware of how significant this issue is, and we want to do everything that we can to succeed here. Thank you.
Thank you. Thank you. Commissioner Burns?
Can you hear me? Is my audio
Yes.
okay? All right.
Hear
So
you.
I think I talk long because the people in my community have been denied meetings by many people on this board. So I'm about to talk long again. One of the things when we push this narrative forward, when I push this idea forward, when I looked at the county manager's past couple of budgets, I saw that the numbers didn't change. And that's not acute to Durham County. That is not acute to public health. That is the same for Duke Hospital. It is the same for Wayman. It's the same for everybody. And so one of the things, Black bodies are not different from white bodies. Medicine works for you all the same way it works for me. The issue at hand is that we have got to change the way we deal with people who look like me and look like somebody else. A second ago, you all, for whoever was listening, Joanne Pierce said you have to be courageous enough to do something different. I think when we push forward this idea, when we saw Vice President Harris, when we saw Natalie Murdoch, Senator Murdoch, when we saw, and I don't know if some of y'all know this, but Joyce Spencer, after she talked to us and we did that resolution, the very next week, she was giving her testimony at Congress. Again, we all did not get together to work on this. We just all recognized it was an issue. I remember that night on the diocese when I said that we've all had nightmares in the doctor's office. If some of you all can remember, the camera started to come on of Black female staffers. I know for myself, I've gone to the hospital, had 103-degree temperature, had to go back home, put on a suit and come back. And they kept saying I had allergy. I had to wait for a Black nurse to walk down the hospital and pull her in a room for her to test me. And she realized, ma'am, you have the flu. That was the only way. Nobody else cared. It didn't matter how nice my shoes were. It didn't matter how nice my suit was. Went to the hospital again because I kept passing out. Nobody could figure out. They said she's obese. That's why she's passing out. That might be a reason why. But you know what I had? I had 18 fibroids. 18 fibroids that were using an extra liter of blood every day. I was passing out every day at 3. I had to wait till I found a Black doctor to actually test me and find out. They just said, no, you're obese. That's why you pass out. Couldn't have been that I had 18 tumors trying to take me out. But that is the story for so many nameless, faceless Black women. When Joanne was telling that story a second ago, I didn't know if she was talking about Beyonce, because that's what happened to Beyonce. I didn't know if she was talking about Serena Williams, because that's what happened to Serena Williams. I didn't know if she was talking about Allison Felix, who is a Lynn Lipper, because you see the Black people, these are famous people. Dr. Ellen Rucker, who was married to Bakari Sellers. I didn't know which Black woman she was talking about, because every famous Black woman that has a baby has to go through the same thing that I have to go through. So the issue is not necessarily building a new program. I applaud Commissioner Long because I asked for this request and she did a follow-up to staff saying, okay, Commissioner Burns asked for this. We did a resolution. Where is it at? I would argue that throwing money at a new program is not what we need. This is an issue of culture change. And I think that we've done a lot of the right things. The CDC, they give out best practices. And I do not want to insult Rod and I do not want to insult Joanne because they know this in spades and I don't. But one of the things that they suggest is that we identify and address biases in healthcare. That really is what it's about. It's not that if you give me a different medicine or give Commissioner Carter a different medicine that we're treated. The thing is that there's a chance that Commissioner Carter and Commissioner Jacobs might even just get access to it, and I don't. right? Because they love to give us older pain pills. They like to give us pain medication. They don't like to go and do assessments. That's what the issue is. So this is, so in their defense, I think a lot of people thought, well, where's the new program? The new initiative needs to be, are we doing standardized coordination of care for folks who are postpartum and folks who are pregnant? That's what we need to do. So when I come in, there's somebody who looked like me or somebody who looks like Commissioner Jacobs, Commissioner Carr. Are we getting the exact same care? Are they asking us the same questions? Are we getting the same 3 minutes? Or am I being told you have allergies or you're overweight and this is why you have it? And are we training non-obstetric individuals on how to deal with people who are just pregnant, right? Like that's the bigger question. Somebody comes in a couple of weeks later and they're like, well, we don't understand why she's depressed. Okay, well, she could be having some issues because she just had a baby. And that's where the mental health conversation comes in, as opposed to, okay, here's this lazy Black woman who is, we don't know why she's here. But she could really say, what's the word I'm looking for? It's not postpartum. What is the word I'm looking for? Somebody, I don't have children, but you all know what I'm talking about afterwards. And let's just say that that's what she's going through. This is the part of the conversation that goes crazy. So I love that the CDC has a program called Hear Her. If anything, if there were any suggestion that I would make, I would love to see, and this doesn't have to cost a bunch of money. I think that our stories are very important. And I think that I'd like to see that and have that shared with the staff, not necessarily a point your finger at your staff, but just so folks can see this is what Black women have to deal with at every medical institution in this county. And how can we make sure that when a Black person comes in front of us, whether we're a podiatrist, an oncologist, an epidemiologist, a nephrologist, or a gynecologist, that they are treated equally and equitably. Like that is what it is, because medicine doesn't change. The way we treat people who request medicine is what changes. So I was not looking for a new program today. What I'm looking for is cultural competency in the programs that we have. And my second look for, in a couple of months, Joanne, I'm gonna come back and I'm gonna say, hey, what was the breakdown of the CUF program? Because I did read that document. And are we seeing African-American women or any women, Hispanic women? I think when we talk about the Immigration Services Office that Commissioner Lom has been championing for a while, we have women who come in there and just do the language barriers. They're not getting access to some of these things. So I want that cultural competency to step up. And for me, I know that I feel confident in you, Director Pierce and Director Jenkins. I feel confident in you, Claudia. And I just, however we can help that happen. And I'll end here. We keep talking about Black people not wanting to get the vaccine. The people pushing the vaccine are the people that they don't trust. Until y'all get that through y'all heads like that, it has nothing to do with the vaccine. They don't trust the people that are trying to give it to them. And that's not about Joanne, and that's not about Rod. They don't trust the people who are trying to give it to them. I took it because, I'll be honest, the main reason why I took the vaccines because I got a daddy with cancer and a sister with lupus. That really was it. It was not because, and of course, the science made sense and it made sense after, but I had to sit and eat it and swallow it. But the people who continuously vote against your interests, don't meet with your people, don't talk to your people, these are the people who are telling you to take it, they're not going to take it. So I wanted to lift those things up, and I wanted to make sure that we recognize that because they didn't come to us with $1 million program at the 11th hour, this is not an issue you throw money at. It's where we have the courage to do something different, like she said in the beginning. So thank you for that. And I look forward to seeing what we come up with and working on the Hear Her campaign, if we can do that here in Durham.
Other questions or comments? Commissioner Jacobs?
Thank you, Madam Chair. And I want to thank you, Ms. Woods, Joanne, Rod, for the presentation, for the information, but especially to you, Ms. Woods, listening to you and your obvious, incredible commitment and dedication to this work and to this program and your many years of service. I really appreciate you. It was really great to get the report and to see all the work that is happening around this issue and the way that Durham County is leading, even at the state level with your involvement, Joanne and Ms. Woods as well. I went back and looked at, I went back and looked at our Durham County, the 2020 Community Health Report assessment. And I also went back and looked at our State of the Child Report, the 2017 State of the Child Report, and how our second goal there was to increase the percentage of moms that were getting access to prenatal services. And that report really zeroed in on that measurement of that only 1/3 of Black women, I don't know if it was actually Black women or minority women, I don't actually remember, were, let me just see, I actually wrote it down. Okay, actually it said 1/3 of babies born in 2015, so it didn't even break it down, had no prenatal care during their first trimester. So we know that this was identified as a goal back in that was in 2017. So it would be great. And then when I looked at the data for our 2020 health assessment, what struck me was that we're doing better than the state, which was a good thing. On most of the indicators, teen pregnancy and also infant mortality, some of the different indicators. The other thing that really stuck to me was that we really have a disparity with our Latinx population as well. So I just wanted to also hold that up, that we have a disparity issue, not just with, Black moms and babies and teens, but in our Latinx population as well. So I guess I would love to see at some point, Ms. Woods, if we could I'd be really interested in seeing how we're doing, I guess, on that one indicator about in the State of the Child Report of getting people into preconception and prenatal care. And I understand, I think, Commissioner Burns, I really appreciate the point that you were raising, and Joanne, about just biases in our entire system. But I also want to hold up just the barriers that people have, that mothers have, whether it's, I don't know if the sliding scale fees are an issue. Lincoln Community Health Center has a gynecology clinic. I have heard about, fees. I don't know if fees are something that we can invest in, or any other barriers that are standing in the way of of people in our community, and how we could help address them. And I'm excited about the Medicaid transformation, and I wonder just what your thoughts are, Ms. Woods, about whether that will give us the opportunity, because Medicaid transformation will pay for things like better food, childcare, or, going to yoga or an acupuncturist, or even a doula. Whether you all feel like some of these new options might be something that we can really try to hold up or could help. So just wondering what your thoughts are about some of those things.
Thank you, Commissioner. So one of the aspects I'd like to address first, the question of about the early prenatal care. That was a concern, and that was one of the goals that we tried to meet when we were doing the managing for results, and also the reports that we had to submit to the county in reference to some of our percentages. And so one of the things that we instituted in our maternal health program and our family planning program, which together comprises the women's health program. So any patient that comes in and gets a pregnancy test and has a positive pregnancy test, we do the presumptive Medicaid eligibility for them. In addition to that, we go ahead and ask them where, should they decide they want to seek prenatal care, where they would like to get their prenatal care. If they decide they want to have our prenatal care, our maternal health clinic is just a few steps down the hall. It's just in the same area. We walk them down and go ahead and schedule them for their first prenatal care appointment so that they don't get lost in the system and they're not set up for care. We go ahead and also, in addition to that, we have opened up extra slots and appointments to start the new OB or first prenatal appointments as early as possible. So we opened up more appointment slots for that, and we are seeing that needle move as far as getting the patients in for early prenatal care. So we've addressed those concerns, and I'm not sure if that was noted in the document that you received what we've done. And we also have our centering programs. We have our centering programs for our English speaking clients as well as our Latin. We have Hispanic centering programs as well. And the data has shown that the centering programs decrease maternal and infant mortality rate because it's a program where there's with the nurse practitioner, the provider, the centering coordinator, and the patients as well, and they assist in their own care. And there have been numerous patients that have delivered, and they've had centering birthdays where they come back and bring the babies, and the moms come as well. And so we've increased our centering. Unfortunately, COVID did put a damper on our centering programs, and we had to go to a virtual platform, which was quite difficult. And moving forward, we will go ahead and reinstitute those again. So those are the things that we're doing to help move that needle as far as early prenatal care, getting the patients in. And while they're here, we also make sure that they are able to access any other resources that they need, because we have our high-risk pregnancy care management program, used to be called PCM, patient care management. And so in that program, we have social workers and we have public health nurses. And part of their responsibility under this program is that they make sure they follow up on patients that have missed their appointments, to make sure that they get to their appointments, and they manage cases of patients that are more at high risk. In addition to that, we have one of our patient care managers who is funded to provide care to the Latinx population that are uninsured but have prenatal care, to ensure that they've been linked to resources and receive their prenatal care in a timely manner as well. And I think one of the other questions you asked was about the Medicaid transformation. So having said that, I believe we are on target that we have all the insurance carriers on target as to being able to, so that they can receive care and use the Medicaid transformation here. And one of the things also is pregnancy care managers. Then we are also with NC Care 360, where that's a large computer-based system where we can see what other resources an individual may need, and we can put in referrals and refer our clients to all of these resources that will be paid for with the Medicaid that they have. If we notice that they live in a food desert, then we can put in a referral for them to be able to go to this area, and we can locate with NC 360 where there is a place for them to get fresh fruit and vegetables, where they can receive a doula or any other type of behavioral health care, or any other resources that they need. So these are just some of the programs that we're working on here at the health department to decrease the maternal and infant mortality rate among Black and Brown clients. And one of the aspects I do want to, the BIDHFL, we were talking about, it not only deals with Black maternal health, but also Black and Brown, and that includes the Latinx community.
Fantastic. Thank you so much for sharing all of that information. It's fantastic. And I guess the other thing I just wanted to mention was, which you brought up about the Family Connects program, and then our Healthy Steps and Reach Out and Read. And so I think looking at our investments in our early childhood system in every way we can support holistically our families, it will help. Just every need that our mothers and our children have and need. So I would love to hear when you all think about other ways that we can support the work that you're doing, and looking at, I know we've got the ECAP coming, but just any way we can just wrap around supports to our moms and our children that could all help you as well. Thank you.
So,
Commissioner Howard, can I just add one quick question?
sure.
It is for Joanne, because I also want us to realize what this line item states, what we're here to talk about. I did open up the door to immigration, and I do know that we have a lot of programs. Programs is not what fixes this issue. It is point blank period. If I open up 10 more programs tomorrow, in no way would it fix this issue. So I pulled the county budget from 2018, and I'm looking at it. And I'm looking right now, and it says Hispanic infant mortality was 4.8 per 1,000. It is 12.2 for Black people. That is almost 3 times as much. I need y'all to hear me, because I wasn't the only one. I done got 5 text messages since sitting here. Y'all not hearing, this is not an issue of programs. This is an issue of we are treated differently. That is in our own budget. That is not from some obscure website. Please hear us when we tell you we are dying at the end. For white women, it was 5, and in Durham it was 1.8, and in Durham it was 1.8 for white women, and for African American it was 7.3. It's almost 5 times as much. Like, that's what I want y'all to hear. And if we're not talking about that, we don't need to talk about anything else. This is not an issue of programs. And I'm just going to our own stuff that we had, and now I'm gonna stop there.
So Commissioner Burns, I thank you for that. I was just going to the last 1, 2, 3, 4, 5, 6 bullets on our document. The first line says, address institutional racism as a root cause and share power with parents and communities. And it goes on to say, ensure families have access to convenient, affordable, preventive, and responsible maternal and child health care. But the one that struck me the most is the number 1. Address institutional racism as a root cause and share power with parents and communities. If that is not addressed, nothing will change. Absolutely. I don't care what kind of programs, I don't care how much money we invest, nothing will change. Black babies will continue to die. Period. If there are no other questions on this issue, we will move on to the next item. Thanks all of you participating in this conversation. Thanks to Jenkins, Dr. Woods, and Manager Pierce. Thank you so much. The next item is Durham Public Schools discussion follow-up, 210370.
All right, good afternoon.
Yeah, go ahead.
Keith Lane our budget director, will facilitate this conversation. And, we started out this budget with over $30 million worth of expenses greater than our revenues. We've been incrementally sort of walking through how do we close these gaps based on conversations with the board in our some of our previous meetings. We've listened and we've tried to look at, well, how do we start making some decisions as we get closer to the budget adoption time. Keith will walk you through a staff's attempt to look at meeting needs that were identified in Durham Public Schools budget that were greater than what we had in the manager's recommended budget. And so Keith will walk us through that information.
Thank you, Claudia. Good afternoon, commissioners. I'm going to try to move through this presentation quickly. Can I get confirmation that you can indeed see the slide on the screen? Thank you. I see none. Yeah, it's much appreciated. Let me go to the next slide real quick. What this slide shows you is highlighted in blue is the manager's recommended budget increases for Durham Public Schools. This is just the delta amount increase. I believe that moves the total current DPS budget up to for 21-22 to $160+ million. I don't know the number exactly. The key number to note is at a $10.128 million increase. What makes up that $10.12 million increase? $1.9 million is the continuation of the $15 an hour for classified employees. Last year, or this current fiscal year that we're in now, the board made a decision to support $15 an hour, but that was after the approved budget, and the board used a general fund balance to support that cost for the current fiscal year, but we had to find additional dollars to support it again in 21-22 and support it on into the future. So of that $10.12 million increase, $1.9 million was for $15 an hour. $7 million, almost $7.1 million if you round up, is for DPS operational increases. And management doesn't tend to get in the business of picking and choosing what particular school increases that $7.1 million is for. We tend to let Durham Public Schools choose where to apply those dollars. But $7.1 million of that $10.12 million was for DPS operational increases. And then the manager's recommended budget also included an additional $1.13 million for current capital. That brought their current capital funding DPS up to $4.5 million. So those three bullet points make up what the manager's recommended delta increase was for Durham Public Schools. It's not entirely what the schools requested. The schools requested $19.92 million effectively. Again, $1.9 million from their vantage point was also to support the $15 an hour. Then they listed in another table that I will show on the next slide, $15.3 million in various operational increases and $2.63 million in current capital. What I would like for y'all to focus on is there's roughly a $9 million difference in funding request versus what is in the manager's recommended budget. How does that break out? This sheet that I'm showing you right here is a sheet that the Board of Education has shown the county commissioners a number of times, and hopefully you've seen it, and it sort of encapsulates their delta increase. It does not include the $1.9 million for $15 an hour, but that's in there. But so that of the $19.92 million total increase, $18 million of that is listed on this table of various increases that they need. $4.2 million for salary and benefits fixed cost, $1.79 million for nursing workers. I won't go through every one of those. Hopefully you can see them on your own right there. What has the county supported? Of that 18 million, again, the county has supported 7.1 million for operational increases, and the county recommended supporting $1.13 million more for current capital. So, and then the 1.9 for the $15. I've now switched slides, and what I want to move to is to say, after hearing from commissioners and hearing some support for additional funding, for potential additional funding for DPS, this is a scenario that management is proposing and hopefully is already discussed with a number of Board of County Commissioners. What is the additional proposal here? Well, after discussing with DPS the value of having public health nurses, the county is proposing that the county hire 10 public health nurses plus 2 support positions. One's a health supervisory position and a processing assistant for 12 FTEs for $1.1 million. Now I need to point out this $1.1 million would be in the county budget. Why is it in the county budget? Because if that $1.1 million were to be in Durham Public Schools current expense, they would then turn around and have to pay 20% of that $1.1 million to charter schools because of the per pupil current expense budget going up. By having the county pay this money out of the county budget for those positions, we effectively save $200,000, a little over $200,000, that charter school surcharge. Does everyone understand what I mean when I say that number? I see some nodding heads. Fabulous. So again, The management right now, and we'll show you on the add delete list after this particular conversation, these numbers, but part of the additional BOCC support may be $1.1 million of county funding for county hired public health nurses. We're also proposing $1.4 million in additional DPS operational funding. Again, we will leave that to DPS to decide where to put it. Finally, an additional $1.5 million in current capital on top of the $1.13 million. That brings the funding level for current capital up to $6 million, which is what DPS has been asking for several years. The current capital funding for DPS by the county is $3.37 million. The manager's recommended budget proposed adding $1.13 million to that number, bringing the total to 4.5. Then this particular proposal is requesting adding an additional 1.5 million to the 4.5, bringing it all the way up to the board, to the Board of Education request for $6 million. So what in effect is happening is $2.9 million more would go directly to DPS current expense and current capital, while $1.1 million would be added to the county's budget for public health nurses. I see nodding of heads, so I get I'm confident that you understand what I've reviewed. There are a number of things that haven't been supported in this list. Informational technology, again, the county doesn't pick and choose of this where they want to support these dollars. But there are a number of things that haven't been funded because we're not proposing fully funding DPS at the 19.92 million. However, there are other dollar options available to DPS. In a presentation given to the Board of Education on May the 20th, on their website, to their board, there was discussion about the use of what ESSER funds, ESSR, which is emergency relief funding that includes ARPA. That's the $150 million that DPS has available through multiple federal funding sources. And there are a few key slides I wanted to show. I won't spend a whole lot of time on them. I think, Claudia, we sent this full presentation to the board as backup material, so you should have it available. As it relates to cleaning and disinfecting and the custodial services, their DPS is currently planning on $6.2 million of ESSER funding to purchase supplies, support contracted services, secure part-time and temporary staffing. As it relates to IT technology or education technology, DPS is planning to use $8.9 million of ESSER funding of that $150 million. I won't read through all those bullet points, but just to note, there's significant funding they're applying to these areas. These are also areas they requested funding from the county. And finally, the facilities and improvements, they are designating upwards of $44.3 million for support of building HVAC systems and a whole host of items along those levels. So I think management feels like that the recommended increases or the proposed increases that I just went over cover a number of important areas for DPS, while ESSER's funding will support some areas not necessarily funded by, proposed by the county for 21-22. So I wanted to burn through it again. So what does the county budget look like after those proposed increases that I just went through? County funding would increase for Durham Public Schools, again highlighted in blue, by $14.12 million. Basically, it's a $4 million increase in county support over and above the $10.12 million supported by that was proposed in the recommended budget. $1.9 million for $15 an hour. Again, the $7.1 million for operational increases. Then we noted $1.4 million more for DPS operational increases or their choice. $1.1 million of county funding in the county for public health nurses, and an additional $1.5 million for current capital, taking that total increase to $2.63 million. So of the requested Board of Education requested budget delta of $19.92 million, this new proposal says the county will support $14.12 million, with the hope that ESSER's funding will support school areas and some of the needs that maybe aren't being met in that $5 million difference. Any questions for discussion? And I'll turn it back to you, Claudia.
Okay. Thank you, Keith. Well, board members, it is tough trying to balance a budget when there are more asks than we have resources. And we're hoping that this is a possible way for us to move forward in supporting the school needs at a greater level. And we will entertain questions that may occur. One thing that we did not talk about is how are we closing this gap? We'll go through an add delete list, but one of the areas that we are planning to do is in projecting year-end reserves and projecting numbers for fiscal year 2022. We know that there are reimbursements that will come to the county, and we are using projected dollars that would typically go into undesignated fund balance to cover this cost. So again, when the add delete list comes up, you'll see that. Anytime though we use reserves, our fund balance reserves, it does mean that we are potentially deferring cost that we will have to cover in the subsequent year. We do know in our overall budget, there are places that will be one-time expenses. And so the impact of the actual fund balance use may not actually be at the levels that we will need a tax increase at that level. But it is our role to make sure we keep that in front of you when we close these gaps. We are also using ARPA funds to help offset some of these expenses, which are appropriate, but any type of expense that we are applying to ARPA that has a reoccurring lifespan, those are ones that we will start programming into next year's budget as we look at, well, how do we close these gaps? So the recommendation is one that we're very comfortable with. We also feel that the board can hopefully over the next several months, well, we're going to take a break for the summer, but as we work towards working on the budget for 22-23 with the school board, we can look at strategies of closing gaps and meeting the needs in a way that our taxpayers can support, because at the levels that we're increasing right now, we just got to figure out what's the fit in us sustaining those levels. And so I'll entertain any questions.
Well, thank you, Manager Hager and Keith for this presentation. And I know that you have worked really, really hard to try to present something that is workable for DPS and for this board. So I just want to say up front right now, thank you. And I know you'll be ready for a vacation. So, commissioners, questions, comments? Commissioner Long.
Thank you, Madam Chair. I just want to echo your sentiments and really share my appreciation to Manager Hager, Keith, Susan, David, and all of the budget team for really working so hard. I know this has been a priority for all of us commissioners, and you've worked really, really diligently to try to close this gap as much as possible. And I'm really excited to hear that we have found a way to bring us closer to the full school budget, and with the ARPA funding and on the school, on DPS's side, hopefully we'll be able to fully close that budget gap. I think it's really great and exciting. I want to thank Manager Hager for all of the conversations you've been having with each of us individually. I know the ones with me have been very, very helpful throughout the process. They've been very helpful to make sure that we know every step of the process of where the budget team has been, what we're working towards, and the addition and subtraction sheet was really helpful. I just had one question, maybe two, just for like the community's sake. I also want to take a moment to thank our educators who are constantly holding us accountable and advocating for our students. So thank you to all of our educators. One question I did have was with the school, I know Claudia, you had answered this to me on our one-on-one call, but for the public to know, what will be the salaries for the nurses under public health? But you're muted.
I am not sure exactly what the salary number will be, and I don't know if Public Health Director Jenkins is still on the call. I'll firm that up, but we do offer competitive salaries, and I am just not, I just can't remember. The thing that we did give to the board is, and when looking at the nurses, because there was an ask that was higher than what we're funding. We looked at the level of positions that are funded to support public schools in the public health department. Right now, there are 20 public nurses that support Durham Public Schools, and we have about 10 vacancies there. The Durham Public Schools has about 7 or 8 positions, and there were 3 vacancies. And so part of this strategy is to look at, as we add these additional nurses, our ability to hire them timely. And if mid-year we are at a place that we've surpassed the number of available positions, that is something that we can consider adding them at a higher level. And so the nurses, that was a very tough one, because many of us as well have school-age children and know the importance of having the school nurse. And the balance was the supply-demand issue, funding positions and the ability to hire them, and balancing it with current patterns. And so that's why we did fund the 12. And I don't have right in front of me what the salary is, and I'm sorry.
Claudia, we had it somewhere, and I hope Rod will speak up. We budgeted it around 67,000. Generally, it's between 65 and 70,000 was the number we used. Rod, you can confirm that, or?
That's accurate, Keith, and Claudia. I happen to be on here. That's accurate.
Excellent. See, I never speak when I don't know for sure. So. And I'm not afraid to say when I don't. Thank you, Keith and Rod.
Thanks to Shannon Wright in our office. She did a lot of work with the health department getting those numbers together. Commissioner Alam, did that answer your question specifically?
Yes, it did. It was really helpful because I know each of us commissioners were asked about the salaries to make sure that they were going to be competitive salaries. And I think I'm really glad that, our public health department is really advocating for that, and our staff is advocating for competitive salaries to recruit the best nurses.
I hope we also sent a summary document to commissioners about the overall public health nurse need in the schools. It was a total of like 34 positions. So do understand that these 10 plus the 2, the supervisory and the processing assistant, meet just a portion of that need, and it will need to be a board decision or policy whether to continue filling out the need, because that doesn't put a nurse in every school just yet, those additional 10 plus.
And for some history, there was a strategy years ago that were established by our former public health director and general manager, Dr. Gail Harris, that incrementally was a desire to increase the number of nurses in schools because of our vacancies and some other timing issues, probably 2 years ago, where it was the first, I guess it was the last that we added some. And so it's great that we are moving forward again in this space, and we'll do our best with recruitment and making sure that we are creative and innovative in attracting. And if when we go to the market, we see that the patterns aren't yielding the pool, because right now we're competing against hospitals and others that have very competitive salaries, we'll come back and update the board on our progressions in that space. Great question. Thank you.
Thank you. Manager Hager, I remember being on the health board when Gail Harris, I mean, she was extraordinary, that her vision was to make sure that there were nurses in every school to come up with a plan. And she started that. It may have fallen off the grid, but that was one of her missions, was to make sure that that happens. So are there other questions? Deborah Craig-Ray?
Thank you, Madam Chair. I just wanted to add that there is indeed a piece of legislation being considered that would put a nurse in every school.
Yes.
And that would be funded by the state. And again, we know the two sides are very far apart working on the budget, but it is at least on the table. So
Yeah.
it could happen.
But you don't know where that is right now. Yeah,
No.
I knew it was there, but I hadn't heard anything lately.
Right. The Senate has the lead and they're working, but the last thing I heard is that they are still far apart with the House.
Okay. Commissioner, thank you. Commissioner Burns, did I see your hand?
You did, and I just want to say, when the superintendent and everybody started, school board started, they were saying 41,000. I remember I said 65,000, and now we're at 67. So to Joe, not just to Joanne, to Manager Hager for taking a request you didn't get it when we thought you would get it, but there were some of us that came to you and it was a priority. I have enjoyed these conversations that we have had over the past couple of weeks, because you saw how creative the math was. There were days I was like, well, can we do this? Well, can we do this? You're like, no, we can't do that. Can we do this? Can we do this? And no, we can't do that. I wake up in the middle of the night, can we do this? Can we do? I wish we could do that for other things. I mean, there's so many causes for small businesses that I wish we could have done it for, because I know that the quickest way to stop a bullet is with a job. There's so many things that I think we could have done for other people. And I know that we're going to do those things because we do have a creative finance whiz who's sitting behind the table. I look forward. I want to echo something Commissioner Long said. She says, this is something everybody is behind. What I look forward to is, and I hope, I don't know if it'll happen, but I look forward to being able to go out to the public and letting folks know that we really put our noses to the gear to try to figure this thing out. And we try to be creative about it. And we try to listen to everybody. And for anybody who is not prepared to do that, you won't have to worry about Claudia. You're going to have to worry about me. Also, to Deborah's point, it is a bill out there. It is House Bill 347. I remember earlier I said it was House Bill 348. So if anybody wants to know how much it would cost, they will give you a good breakdown. Just so so we don't have to go to school of government. I asked them, like, you can actually go to the bill. I don't know where it is now. Like Brenda said, I think it's still sitting. It was on Senate side, Senate House side, but it is House Bill 347. And what I would encourage people on this phone to do, I know that I have gone to some of my folks in the General Assembly delegation. I've actually gone to some who are not in our delegation, who are on that committee. If you are truly committed to this cause, and I've sent this email to the school board, then I hope that we can see letters from each person on here, hoping that the state can do that funding. If we keep saying to the public that the state isn't doing their part, we have to do our part, and then we do our part, but then we don't put pressure on the state, do we really care about this issue? So I plan on writing my letter this week. I invite my 4 colleagues to do the same, because if we really care about teachers having what they need in schools and students having in schools, we will use these awesome privileges that we have been given as elected officials to push this legislation forward.
And to add to what you just said, Commissioner Burns, the Association of Counties, there are a lot of county commissioners that support the nurse, that bill. So contacting other commissioners across the state and having them contact their representatives as well can be very productive. Any other questions? Commissioner Jacobs?
Thank you. And I just want to echo some of the comments that have also been said already. I really appreciate Manager Hager, just the incredible communication that you've had, I think, with all of us individually, but also, and also to Keith, with your communication with DPS staff. I mean, getting this document that we got last night that Claudia sent, and I don't know who was involved, but the response from Durham Public Schools related to the question of the nurses and the social workers was just really, really helpful and reflected the kind of communication that's going on back and forth right now between our staff and also Durham Public Schools. So this is really great. And I do appreciate the work that has gone into doing our best to try to address these important needs. And I support what is being proposed. I also do have a question, though, related to the social workers, whether there was any possibility. I know there was a request when I read this document from Durham Public Schools. It was also the 7 social workers that would cost about $700,000. And I didn't know if there was any way we could look at that as well. So I just wanted to hear staff's input on that.
Well, from my perspective, the dollars that we're allocating, the 1.4 million that does not have a designated area, if that is a higher priority, that does allow the board to fund the social workers. We typically, as Keith shared, we give the dollars to entities, especially the schools, in one lump sum. And based on their best efforts, we allow them to decide how to use those dollars. Like us, they're still sort of learning of new dollars or potential funding. I know they're still waiting to see what the state budget does. And so with all of those factors, we would just offer that they see if that is a higher priority, that possibly is used for that, but again, would allow them to determine how to close that gap. Not knowing how they're using some of their federal money that is coming in, I'm not sure if some of this may be covered. Because of time, we just didn't have a chance, although we've been back and forth to sort of know all the nuances and how they're planning to spend some of their ARPA and other funds. But we'll see what their response is. Like our other areas in county governments and other places that were funded, when it's not quite that number, that they ask for it is often challenging. But from our perspective, this was a best effort in trying to close some of the larger needs.
Okay, thank you. I appreciate that. And I guess to Keith's point about recognizing that, and I think it was reflected in the comments that we got back from, I'm assuming it may have been Nurse Howard, who's head of the school nurse program, who supplied a lot of these answers, but the understanding that it's going to take, probably 3 years for us to meet this goal that Gail Harris laid out many years ago of making sure that there is a school nurse in every single school. And I just want to say personally that I am committed to that. And I think I've said before in our meetings that I would like to see us, our staff work together with Durham Public Schools staff onto how to really make this happen over the next 3 years and phasing this in. I think that, when we look at upstream investments, even looking at roots of things like gun violence in our community, that making sure that people in our community, that our children, our youth, our families have the physical and mental health support that they need, at every level, is really important. And I'm excited about what's possible with a social worker and a school nurse in every single school. And the model that the schools have right now of child and family teams, I think is a fantastic model of, this model of, wraparound support and bringing people together when there is an identified need with a child or with a family, and making sure that we bring in all the resources. I just hope that we can really invest in this, especially with COVID. And we know the mental health impacts that it's really had on our children and our youth. So I'm excited about us making this investment, but I do think and I'd like to hear from other board members about, us really knowing that we're committed to doing this over a 3-year period. And I guess I guess one other thing was, and I don't know if this is something that we would want to look at for the MOU with it that we have with the schools, if that would be something, supporting this kind of child family team model, and the way that we're working together on pre-K, that we've made this a joint goal between Durham Public Schools and the county, having the commitment that Durham Public Schools has made for having a pre-K in every single elementary school, and how our pre-K staff are now presenting, whether it's just a memo, but that's like a part of our joint meetings, is getting these reports on how we're doing with pre-K, and just thinking about this joint nursing program that we're doing together and how we're really doing with that. So just want to throw that out there.
Yeah, Commissioner Jacobs, can we hold off on that until we have an opportunity to discuss the MOU? Because we're not doing that today. I know that there have been some additions to the MOU that I haven't had a chance to go through, and I'm sure nobody else has, because our focus has been on this budget. So if it's okay with you, let's hold off on the MOU and until the staff, because the staff is going through it right now as well to see what are the budget implications. And we can talk about that either sometime in probably September, in August, when we get back from vacation. But I'm recommending that we don't do that right now. Any other questions about the school's budget? Commissioner Carter?
Thank you, Madam Chair. Boy, I just want to say, I have a lot of happiness in my heart because of this recommendation that has come forward from our staff. I feel and I want to associate myself with what every other commissioner has said here about feeling gratitude and appreciation for the way in which our management staff have really read us, during these discussions, helped to figure out where we're clearly in agreement, help figure out how to bring us together where we might be a little bit diverged. And I can't think of anything more important than that, and really appreciate it. And really enjoyed my conversations with Claudia. I appreciate you reaching out so much. I just think that, we're really digging deep here $4 million will have to come from fund balance, another 4 million in order to, meet this newest proposal. And I think it's exactly what we need to do. I think we've heard from the community about how important it is to fully fund the schools. If we believe the list on this request list, if we believe everything on it is important, and I think we do, that's why we're trying to fully fund. And I think that as we look across our own local funding, our local resources, and also the federal dollars coming in through ARPA to the county and ESSR or whatever to the school district, that this can be fully funded. This request, this 19 million, 20 million, whatever it is exactly, request can be fully funded. And I feel, like I said, happiness in my heart about that. I also feel really excited that there's the possibility of phasing in over time, perhaps 3 years, a nurse and a social worker in every school. I agree. I was on the school board when the state funded the child and family team model by putting a social worker and a nurse in some of our highest need schools. And I think it worked, it helped, and would like to see us continue that and look forward to those conversations going forward. But I just have so much commendation for our staff for helping us get to this place, and look forward to celebrating, all together around this.
Thank you. If there's nothing else, commissioners, we're down to board final directions and funding discussions. If this conversation is going to last for an hour, we're gonna need to take a break. Well, so if it's gonna last a few minutes, then fine, but otherwise we're gonna need to take a break.
It is totally up to y'all.
We're gonna need
I think that it can last in a few minutes, but no. Well, let me tell you what our final steps are, and then you can gauge. We typically in a budget cycle, you have some technical adjustments, which are, there's a sheet that's showing right now, which are the blue shaded areas. And so, and then there are some areas that have been noted as priorities, which are the purple shaded areas and the ones below. And then, and I want to say priorities in that there has been interest made by board members or as we've talked about the budget or questions or et cetera. And so we've put a list together. We shared it. It's hot off the press. We shared it a little bit earlier, and they're trying to make it a little bit bigger so that it'll be easier to see. But we've talked about the ones that are related to Durham Public Schools and in the purple area. And I'll focus on those. We talked about the schools earlier in the process. We talked about the refugee and immigrant services position, which will be a shared one with the city. During the conversations about Durham Technical Community College, there appeared to be interest in bolstering some of the dollars. There was an ask that was not included. As you know, we could not meet the full budget request that was presented, but there was some, as explained in the data supported, an additional $175,000 for the Bulls initiative. And so we did place that there based on conversations. This next one was one related to funding for pre-K. And so we put a number there for that of $250,000. We know that there are some federal and state dollars that are allocated for that. However, there are some gaps for families that sort of fall outside of that window. And so what we're proposing is that this number is supported, and as we see patterns, if we have to come back to the board, we will at least, I'm sorry. I didn't silence my phone. Sorry about that. We will let the board know if that adjustment is needed. The next one is the recognition of the revenue for the city's cost share for the DSS Tax Relief Grant Program. And then there is the allocation using ARPA funds for the Black Chamber of $50,000 to support a specific area with the marketing efforts, targeting, training, and technical assistance. This is a continuation of some work that they did with the city, and the city will also make a recommendation later on a level through the use of ARPA funds. The next one is related to our non-congregate housing. This was not in our base budget. This is a continuation funding for those expenses for the next 6 months, and we'll see what the patterns are after that point. And I think and then the last ones are areas that came up during discussions, not sure where the board may be. It's the dollars for DOS funding. There was a request for the master aging plan, funding for behavioral health infrastructure stepping up, and based on the conversations today, we feel that is one that the board will support. This next one with the behavioral health capacity is the one I mentioned briefly from Alliance. The way our contract is with them, when they don't spend their total budget, those dollars revert back to the county. And this was the ask we talked about earlier. And we're saying that we're recommending that those dollars are carried forward into the new year. So we have the dollars in our current budget, but we would just allow them to increase their capacity for next year. And then there was the request for the, and I cannot remember the acronym right now, but it's the BTAC program and the Green Jobs Training. We didn't put a dollar amount for that. In our base budget, there was not a request for that, but there was some follow-up about the program. And this may be one, especially for the program expansion, that we come back to the board once we get additional insight, or it's one that the board can consider. So these are some of the areas that we've identified. Again, we shared this list earlier today, and it may be something that we can address now, and I'll let you, again, y'all decide how you want to proceed.
Claudia, I would just like to note that the net additional cost to the county is $3.67 million. The numbers are slightly different from what you showed earlier. These numbers are almost always constantly in flux, but it's close enough. $3.67 million, and management is proposing using general fund balance to support this cost. Claudia noted it earlier, and I feel like it's my duty to reiterate real quickly that using fund balance is great for 1 year, but a number of these issues are ongoing costs that we'll have to find an ongoing supporting revenue source, generally property tax growth, sales tax growth, increased property tax revenue from an increased property tax rate. My point in telling you that this $3.7 million we can fund with fund balance, and that saves us from having to do an additional tax rate increase on top of the 1 cent for this fiscal year. But next fiscal year, 22-23, we're going to have to find a different source of funding for this almost $7 million. And some other funding we've already done. We're using $3 million of debt service fund balance in this budget we're developing now that won't be available next year. So you're getting close to $7 million. That's not necessarily a bad thing. It just means it's yet another issue you all have to carry around in your heads is how do we continue to pay for ongoing wants and needs and things we are supporting in the future with ongoing revenue sources. We can't always fall back on fund balance for all new things. And I know you know that. I just feel like it's my duty to tell you that one more time.
So
But-
Keith, can you just go over slightly the ones that are continuous cost?
Well, continuous cost would be the school funding for $4 million more, basically. It would be continuing costs for the refugee and immigrant services position. Once that position's hired, I assume it will stay hired for any number of years. I mean, unless you choose the Black Chamber of Commerce, is that a one-year funding? Is that perpetual funding for the next 5 years at $50,000 or more? The DSS tax relief program, that's revenue, but let's see, the increased funding for pre-K, it's only $250,000 this year, but in previous years, we bumped it up $1 million, $1.5 million, more than that to get ultimately to full support for everyone having available pre-K at 20 to 30 million. It's numbers like that we're adding to the budget that will not go away next year unless you reduce budgets equal to this amount or you take this money back, which is somewhat doubtful. The point, yes, David.
Keith, those numbers I just highlighted in green in the middle, ironically, they add up to right about $4.5 million, which, as everyone on this call probably knows, is about 1 cent of tax increase, this is kind of the recurring highlights of this sheet.
Yeah. And so as we plan for next year's budget and based on conversations about our planning for the bond referendum as well, we will start conversations with the board on, what is it going to take to do incremental increases based on patterns. And going into it, we know we will, like this year, have to potentially raise taxes unless revenues are projected and paced at much higher levels than we're seeing now. So we will work through that and we'll keep the board abreast of that. Then the dynamic of it again, as we plan, we always look at, of course, the current year, but we're always looking at least 5 years out.
Just one more question, Claudia, for clarification. So what we would have to look at is we have to raise 1 cent next year to cover what we're doing this year.
Well, we would have to cover it, but it's a tricky issue in that we're appropriating $23 million worth of fund balance. In years past, we've not had to use fund balance. And so there is a probability to cover this expense, we will have to raise taxes. And so we're using fund balance at levels higher than we've done in the past as a way to mitigate the tax increase. But we also are comfortable with the levels that we are proposing. Going into next year, will we have to raise taxes based on current patterns? It's a high probability, but it's also a probability if we contain cost and look at where we can revisit base budget areas, and not only with the county, but across the board. How do we change our growth patterns? And that's a larger, broader conversation. When departments, as you know, when we started this budget process last year, this time, we didn't know where we would land because it was a free fall with the economy. And so a year later, we're definitely on more solid footing. But with all that being said, departments went through exercises of looking at base budgets, looking at what's required, what is not required from a mandated services perspective. and did a true base budget assessment. We're at the point, in my opinion, with our growth that we, across all areas that we fund, just need to look at how do we manage our budget with the pace in which our revenues are naturally growing. There are situations that we will have to raise taxes, but in those spaces, we just need to make sure we've carefully looked at all areas to make sure it's the absolute last choice. So.
Okay, one other question and then I'm through. The master aging plan request. So the city has not included that in their budget?
I'm sorry?
The master aging plan, the city has not included that in their budget?
That is right. At this juncture, it's not in the budget. As you know, this request came after the recommended budget. And so it may be one that we can bring back to the board later. But I'm not sure what the city will do. I know they will share, I believe, the plan information at the public hearing. But we can either move forward or we can wait to coordinate with the city. And I think it was just a timing issue because I know the board invested in the study and it is one that is very important, but it's, in my opinion, a timing issue and everybody just sort of needed to get up to speed, but we did put a placeholder here just for consideration.
Yeah, I know that the city had was on board with it. I just didn't see, it didn't say that the city's that it was in the city's budget. So that's why.
Yeah, it was just a time. Yeah, it was just a timing issue because it came after the request, but after the recommended budget happened.
Okay. All right. All right. Any other questions from commissioners? I don't see any hands. I don't see any hands.
I have one, Madam Chair.
Okay.
Well, is staff looking for some direction from us? Some very, clear direction? Like, do you want us to say we accept all of these or we don't? We want you to take this out or?
You're on mute, Claudia. Sorry.
I'm sorry. And Keith, you can chime in too, but that's the place that we are now. We would like to know if there is agreement with the items on the list and the levels that are there. And we've talked about the schools. We've talked about many of the others. And so we can.
Right. Claudia, if I could.
One by one, sure.
The blue ones at the top aren't really arguable. Those are changes based on later information. Those are just technical changes. Actually, the net is actually a small decrease. The big ticket items are the ones in purple and the ones in green. And whether you're continuing to support non-congregate housing using ARPA funds for the next 6 months, which I think you are. So really it's the purple and the green. And if the board is in agreement that these things are acceptable at these costs, the net cost to the county is $3.6 million, which management is proposing using fund balance to support, not a tax rate increase. Love to get either approval on all of these or discussion on individual ones and then amounts so we can ultimately get to a bottom line number and say this is how much we're going to add or subtract from this number to the manager's recommended budget to get to an approved budget.
Any other questions from commissioners?
I just want to follow up on something that Commissioner Carter said, if I could jump ahead of you, Commissioner Jacobs, if that's okay, because it speaks to her question. I had the same question that Commissioner Carter had. I guess for me, 90% of this, I don't have a problem green lighting. There is one I do have questions about. Many of us raised questions. I think that some people did not really look at the Black Chamber of Commerce budget or look at the proposal, because if they did, they would have seen maybe some of the things that I saw, and questioned, what was the deliverable. I'm not saying that we don't fund this one. I would, and I want to follow back up with staff, if that's okay, to find out how they're going to work in conjunction with the Institute, with the Chamber, and with our own MWB staff, because as I've made very clear over and over again, that staff is understaffed. It used to be 3, there used to be a director, we have 1. And so we're bringing in an organization to do a job when I asked 1,000,000 times for it to just become a job, and then we don't necessarily know. And I've seen the email traffic, and I'll just say this: I don't think that people looked at it. This one has been put in 3 or 4 times. I'm not saying that we don't fund it. I just think, again, we have multiple entities looking at this, and I want to make sure that they're all working together, so that we can get the best outcome. So I'm not saying pull it. I'm saying just know in the next couple of days, I'll be emailing, and I would hope that before we move forward with anything, that we have these folks working together, because as you all know, we have an MWBE problem here in Durham. So that's all.
Duly noted.
Okay, other questions or concerns? Okay, Commissioner Jacobs, did I see your hand?
Yes, thank you, Madam Chair. Well, first of all, I just really, again, want to thank our staff. Thank you, Claudia and Keith and all of your budget staff. It's really so helpful to us to, that you have pulled together this add delete list. It's great to see some of the savings, but just this is how you all do your magic. And again, I really appreciate how you've listened and heard from board members about priorities. And again, just appreciate it. I support what's on here, and related to the master aging plan, I did have a conversation with the mayor today about where they're at with that. And I'm sure, Claudia, you can follow up with the city manager. But my understanding is that they, and I like the idea of this being a placeholder. Obviously, we have to wait until the city takes action. My understanding is they probably won't be able to take this up till maybe in August when they have a work session. But obviously, this is something that the city is a partner on. I think it is a timing issue. My question is, I had sent this into staff related to the funding for the tax deferral program. We had funded 3 positions for the tax deferral program in last year's budget. And obviously that we only got 1 applicant for that program. So one of my questions was, do we still need those 3 positions to work on the tax deferral program? And is there any savings in shifting some of that over to the tax grant program instead? Because I think that's where we're going to get real interest now, is in the tax grant program. So I was just wondering if that was one possible area of any savings.
Well, that's a great question. And we're finalizing some responses that we'll get out. But if my memory is correct, from conversations with Dwayne, although a lot of the workflow will happen in DSS, there will also be workflow issues because of this in the tax department. And so what we want to do is to see what those patterns are, and then mid-year do some calibration or realignments. The follow-up that's required and the nuances of having something new, we just want to make sure we can share the load, because we also see an increase will occur also to the tax department with inquiries. And so although DSS will do the actual program implementation, we also anticipate an uptick of questions. So there will be some coordination. So right now, we're just proposing to keep those, and we'll look at the patterns. And if you may recall, when this was looked at a couple of years ago, the numbers that were requested were much higher. They were closer to like 7 positions that were going to be needed. And so again, by having this capacity to backfill, we feel we can make sure there's a continuity of service and we can provide good service to our customers, our residents when they do call.
Okay, well, thank you. That makes total sense. And I would just add that I know we are asking the city to jointly fund the operational costs, because this will be a joint city-county tax grant program. So I hope that we may need to recalibrate what we ask them to help us share as well. But thank you so much. I appreciate that approach.
Commissioner Carter.
Thank you, Madam Chair. I just want to, say that I support where we've landed. So I'm supportive of this. And where the question marks are beside the BOCC program, and also that the BOCC program was linked to the Community Conservation Assistance Program, which is a match, I think, for lower income households who would like to put best management practices for stormwater in their yard, like rain gardens, for example. And that's exactly what the BOCC students build. I think it's Bionomics Education Training Center. I hear about this occasionally on the farmland board, or I would have no clue. So I know the CCAP, the assistance program for lower income residents, they had listed 170,000. I would ask staff maybe to work with Mike Dupree and anyone else from Soil and Water to, I don't know, get a reasonable number there. And if this isn't the right time, okay. But it seems like it could be a really good time to devote some funding to that. If you all would mind just looking into that a little more.
We can, and Jay can jump in. Part of the reason we did have a question mark was that I don't believe this was a part of their original request and for both programs. And so we were doing some follow-up, and we ran out of time to put the right numbers. But we can definitely look at this and see some of the analytics to determine what's the right number. I know for the BOCC program, there was, as we were doing some sidebar conversations, I've had so many sidebar conversations lately. And I'm a data person, so I was asking questions like, well, so what's the trends? What are the patterns? What are the actuals? I know last year was an anomaly or this current year because of COVID. And so we want to make sure that we give the board our best information. And this is one that we can come back to you on if we don't do it right now. But we can definitely follow up on that.
Manager Hager.
Yeah.
Yes.
Go ahead.
Manager Hager, we received actually a reply, I think possibly during this meeting, from Soil and Water. And it sounds like, from what I can read of the email, that's a pretty lengthy response, they're covered for this summer for the BOCC program. Going forward is when they're talking about maybe they'll look at an additional need. But for right now, it sounds like they're comfortable with a couple different options they have this summer.
Okay, fantastic.
Okay.
So if we can maybe come back to the board in August and see what levels we can do for that. I think that
would be perfect. Thank you.
And it would be great to send the board some information, because I don't have a clue what this is.
Okay. All right. And Jay also had.
Well, we all received a few emails about it. One from Matt Kopech and several people from Environmental Affairs Board, and then Mike.
Oh, I thought that was something else. I guess we've received so many emails. I thought that was something else. So if the staff would send us one email that encapsulates all the information rather than 20, it would be great.
We can do that. And
Thank
Jay also had a.
Thank you, Manager Hager, and good afternoon, Chair Howerton, Vice Chair Jacobs, and Commissioners. Just a couple of points. One, Eddie's reply did indicate they are, as David indicated, they're covered this year for the budget. We appreciate the support in the community and the strong outpouring of support. I think one thing to keep in mind is Eddie's group is also what I'll call staff limited. They're to use a sports term, they're out punching their weight class right now. And I think we need to evaluate where are we going to go? What do we see in the pandemic recovery with people willing to send their kids to programs and things like that? And so perhaps let this unfold and also consider before we try to expand or add, what sort of, for lack of a word, human infrastructure may Eddie's group need as we move forward into the next budget year in order to support expansions. I think that's going to be very important to make sure they can be successful at it. So we'll certainly look into it, and we recognize the support and desire in the community and appreciate your patience as we do that evaluation. And just as I think Claudia made the point too, this was not part of their original budget request, recognizing some of the constraints they have and that they were funded for the current summer coming up. Thank you.
Okay. All right.
Claudia?
Is there
Commissioner
anything else?
Harrison?
Yes.
David Ades is going to speak to a couple of changes to some budgets in other funds. Particularly our risk management fund was a very late request based on some late information coming into that department and then relate to us. David, this doesn't affect the general fund and it doesn't affect the tax rate, but it does affect our overall budget. So David, take it away, please.
Mostly an administrative issue with the RTP district is we got some updates on the tax valuation that changed our projection for them, and we worked with them, and they're in agreement to use fund balance to kind of fill in that gap. And we've reviewed their fund balance, and they're well within the county policy there. And it's actually a decrease in overall expense, but it ends up zeroing out. And then finally, actually during this meeting, it sounds like our risk management team received insurance premium costs for this next fiscal year. It's one of those things where I don't know that they control the timing of those. And unfortunately, the costs are much higher than our projection. Their projection had been, we always budget in a little bit of an increase, but it wasn't a little. In taking a look while we were on this meeting, they need $700 more to cover their premiums, which is a significant increase. Luckily for them, they have a fund balance that can cover it, and we've checked with their team. And we even have enough within limits there for the actuarial amount. So it's our recommendation at this point that we go on and add that to their budget so we make sure those premiums are covered and cover it through fund balance. And as we go forward over the next year, we'll work on better understanding future premium costs and building their budget, hopefully a little more accurately to start. As we all know, insurance premiums are one of those things that, year to year can be quite variable.
But do note that $700,000 increase in premium that the risk management fund balance is paying for next year. The year after that, the general fund will have to find a way to pay that cost because that's generally departments are charged for that. So indirectly, that's another general fund dollar amount that we're going to have to fund in 22, 23 on top of the $7 million. It's costs like this that cause Claudia and my office and other management folks concern every year. It's growth by choice and it's growth by no choice. And this is one of those non-choice growth numbers that we have. Thanks, David.
Okay, thanks, Keith. Anything else?
No, this covers the list and sort of wraps up what we had to share with the board. I know that we had tentatively planned to have a discussion on, I guess, on the 9th, but we've pretty much covered the major items. The 9th discussion was we just had one item that we can bring to a board another time. It was to talk about broadband. And we were gonna use our ARPA funds for that. And so if it's the board's pleasure, we can find another meeting to give an update. I think that would be a good conversation for our residents to hear as well. So possibly at the 24th meeting,
Okay.
that may be a good one. And so otherwise, I would say that we've covered all of the areas and appreciate the board working with us, and look forward to having an adopted budget on the 14th.
So we can delete the budget work session for Wednesday, the 9th at 9 a.m.
Yes, ma'am. If y'all just want to just meet.
We love you.
Yes.
We love you. We love you, Claudia, but we don't have to meet.
Yes.
We don't have to meet. All right. Anything else for the commissioners? If not, we can adjourn.
Okay.
Thank you so much, everybody. Bye. Bye.
Bye.
Thank you. Bye.
Bye.
You.